Okay. Good afternoon. I'd like to call to order the Ottawa County Board of Commissioners meeting. The date is Tuesday, March 9. Our invocation today is by Commissioner DeYoung, followed by the Pledge of Allegiance by Justin Roebuck. Please rise.
Will you pray with me? Heavenly Father, we just thank you for this opportunity to come together as a board and to make decisions for those of Ottawa County. And Lord, we pray for our residents today, Lord, whether they're suffering financially or health-wise, Lord, we ask that you would be with them. And Father, we always ask for protection and safety from our firefighters and all the men and women of the Ottawa County Sheriff's Department. And Lord, a special prayer today for our health department workers who have the past few months just have worked overtime during this COVID pandemic. Lord, be with them and give them what they need. In thy name we pray. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, Justin, would you call the roll, please?
Yes, sir. Mr. Garcia.
Here.
Mr. Baumann.
Here.
Mr. Zylstra.
Here.
Mr. Dannenberg.
Here.
Mr. Ratlink.
Here.
Mr. Terpstra.
Here.
Mr. Holtfluer.
Present.
Here.
Mr. Kyers.
Here.
Mr. Bergman.
Here.
And Mr. Fensky.
Here.
Mr. Chair, we have a quorum.
Thank you. Under presentation of petitions and communication, public health update. Is Lisa on or someone from the health department? Or is someone here? Not. I guess we'll just put that off for the time being and pick it up later.
I know she's planning to present today.
One
He
quick
is?
second
Yes.
here.
Okay. All right, let's have Mr. DeVries come forward and give us his update, and we'll see if she comes on later.
Thank you, Mr. Chairman. Commissioners, good to see you guys again. I'll just run through a little bit of a summary of what's going on in Lansing, and I would love any questions you have after that. The one thing that's been the most interesting thing, or maybe even you could say troubling thing for this year so far, is just the relationship between the legislature and the governor is not in a great spot. I'm sure you've seen some of the media reports. There's been a lot of name calling. There's been a lot of aggressive talk in maybe some unnecessary situations, but things have not been great. And the first substantive policy thing we can talk about is this budget supplemental that they just finished passing last week. And I think it was a good example of how things are just struggling right now. I mean, the legislature was trying to appropriate several $1 billion that had come from Congress and former President Trump late last year, all related to COVID stuff, education funding, testing funding, vaccine rollout funding, et cetera. And it just took them a long time to try to get this done because they weren't talking to each other. And when they did talk to each other, it wasn't terribly productive. And it ended with, pardon me, it ended with the legislature passing a $4.2 billion supplemental without the governor really having any input. She wasn't involved with the negotiations. When she tried to offer stuff, the legislature mostly just kind of said, we're going to do this one on our own. And they tied 1.2 of the $4.2 billion to two separate policy bills that kind of ratchet back the governor's power. The first one of those bills would put a 28-day cap on any sort of emergency orders by the DHHS director. After the 28 days finishes up, the legislature would have to vote to extend the order. And if they don't, then the order couldn't be reinstated. And the second bill would move the authority for opening and closing schools, including all sort of related activities like school sports, to the local level, to the county health department or a city health department. And so both of those bills are tied to this $4.2 billion budget supplemental. It's widely expected the governor will veto both of those bills that are attached. And then that removes $1.2 billion out of the budget because $1.2 billion is attached to those two bills. And so I think this is the legislature's attempt to push back. I think you've heard the legislature complain quite a bit but how the governor, in their opinion, is overreaching. Whether she is or not is probably a matter of opinion, but they're trying to push back in this way. I don't think it's going to be terribly effective. I mean, there's not a ton of leverage here for the legislature. They're kind of threatening funding for popular programs with money from Congress. And when it gets vetoed, and I think that it will, they're going to have to come back to the table and find a way to spend that money anyway. So that's what's going on. And it's just, I think, an indication of how bad the relationships are at the moment. Part of it is that we're going into an election cycle. I think the Republican leaders in the House and the Senate feel like it's their job to help make it harder for the governor to win a re-election. And I think the governor, maybe some of this is on her for having some communication challenges with the legislature as well. So regardless of how and the why, that is kind of what's happening at the moment. And how that kind of relates into the overall rest of the term is still unknown. I think we'll have to see and wait and watch. But on that same note, the governor did give her new budget presentation about a month ago. I would say that this one was a little bit less controversial, just substantively, than previous. There was no tax increases included. There were no major new programs. It was just kind of cost of living increases across the board, et cetera. The legislature will push back because that's what they always will do. But I'm confident that at least on the substance, this is not quite as challenging as some of the other ones have been in the past. There was a 2% increase in county revenue sharing proposed from the governor. One thing that I also found notable was last year we talked quite a bit about some of the criminal justice reform, things like raise the age that could have an effect on the county. And I was happy to see that the governor included about $70 million in proposed funding for those programs. That was always our concern all along, is that if these changes were made, then we didn't want to be left holding the bag. That if the state wanted to make the change, the state had to be able to fund the change. And it looks like they've done that. Some of this will be then trying to square up how much it actually costs once the program is fully implemented with how much was appropriated. But I think it's a good sign that the intention is there to fund what the legislature has passed. Through the budget process, we're going to move forward again with what we tried to get some money for our groundwater monitoring system funded last year. Through the COVID budget, there wasn't an opportunity to get any sort of special projects like that done, but we're going to be back at that this year, working with our local legislators on that. The one other thing that's kind of out there that we're monitoring is potential continued changes to the Open Meetings Act. Right now, the Open Meetings Act allows local governments to meet remotely through the end of this month. And then through the end of the year, if the local unit of government has a local declaration of emergency. And some want to extend that either to the end of the year just for any reason, or some want to make it permanent, et cetera. There's a large contingent of the Republican majority in both the House and the Senate that want meetings to move back to in person as soon as possible. And so I would say that it's unlikely that that's going to get extended in any sort of meaningful way, maybe a small extension, but I do believe that most these local governments will continue to meet remotely as needed through the end of the year under their local states of emergency. But I don't see a huge extension possible above and beyond that. That's what's going on for the most part. It's been a little bit of a slow start to the year, partially because the supplemental was as big of a challenge as it has been. But things are starting to pick up just a little bit, but there hasn't been anything else that would be significant to the county one way or the other. So happy to answer any questions that you guys have.
Anyone have any questions of Mr. DeVries?
Mr. Chairman, I got a couple. Bob, I wonder if you could give us a quick government lesson. What would happen to that $1.2 billion if they don't come to agreement? Is there a chance of that being lost and returned?
In theory, I would say that's the worst case scenario. I don't know exactly what the date is, but typically there's a date that if it's not spent by, the federal government will take it back, but that date is not imminent. And so I think what will happen is if it doesn't get immediately appropriated, it will get appropriated in the next round. I would imagine there will be another supplemental budget before the big budget gets passed. whether that be in June or July sometime. But I do think we'll have a supplemental in late spring or maybe early summer, because there is a lot more money from the feds out there to fund a number of things yet.
And so then I can imagine that the next funding source, the ARP, the American Recovery Plan, that also would create an opportunity for folks not to agree on how to use that money.
Yes, absolutely.
Okay. It's my understanding that you can also use that money for broadband possibly as well. Is that correct?
Yeah, I'll tell you, I'm not super familiar with what has just been passed in DC yet. We'll have to take some time to look at that. But I do know there's quite a bit of money coming to the state and potentially for local governments. But broadband was part of the last federal spending bill, and I imagine that it's part of this one as well.
Okay, thank you.
Anyone else? All right, okay.
And Mr.
Doug?
Zylstra. Oh, sorry.
Doug, go ahead, Doug.
Yeah. Hey, Bob. Thanks for stopping by. I just want to pick up on that last question. Is the American Rescue Plan coming straight to us, or does it stop off at Lansing? My understanding was it comes straight to us.
Yeah, I'm not sure. I'm happy to find out. Last
Okay.
time, the 5 biggest local governments got things directly from Washington, being City of Detroit, and then the 4 largest counties. My understanding is that maybe broadened a little bit, but I'm not sure what the limitations are. But I'm happy to check for you, Commissioner.
Thank you. Appreciate that.
And as always, a lot of these things are developing quickly. I'm always happy to, you don't have to wait 3 months for me to come back to get questions. John and Al and I talk regularly. And so if you have questions, please feel free to shoot them directly to me or to John or Al, and I'm happy to give you guys an update in the interim as needed.
So Bob, when you get those questions from a commissioner, would you make sure that you copy that question and answers to all the commissioners?
Happy
We
to,
all
for
have
sure.
the
Usually I
information.
make sure that Al is included, but happy
Good.
to include anybody that would like to be included.
All right, good, thanks. Anyone else? If not, thanks.
All right, have a great day.
Yep, thank you. Okay, I understand that Lisa is on now, so let's hear from Lisa. If she's there someplace.
Hello, everybody. Boy, every week things change so much. I'm going to start our brief presentation today just with some of the statistics about COVID-19. As of Monday, 22,651 cases of, we've had we've had 22,651 COVID-19 cases in Ottawa County as of 3/8. We've had 346 deaths and 694 total hospitalizations. Our case counts and positivity have both plateaued over the last 2 weeks, which is really good news. This is similar to what we're seeing across the state and the nation. 2 weeks ago, our weekly test positivity fell to about 2.9%, which is the lowest level that we've seen over the last 6 months. But since then, it's just increased a little tiny bit to 3.2%. So we're watching that very closely. Hospitalizations and deaths remain lower than the previous months, but have not yet fallen to the lows that we saw, very early on in the pandemic last summer. Over the last week, we've been averaging about 33 cases each week. You'll remember that during November and December, we were seeing in the hundreds, some days 450 cases. So 33 is very good news. All hospitals in Ottawa County reported offering normal care. They're not in a crisis mode right now. 3% of hospital inpatient beds were used by COVID-19 cases, and 4% of the ICU beds were used by COVID-19. Again, this is really a positive trend that we're seeing. With regard to our testing numbers, this is kind of what we use to figure out what's going on in the community. The number of tests run now stand at about 850 tests per day and roughly 6,000 tests per week. The time that it takes to get a COVID-19 test result is 1 to 2 days. And you may recall that during the surge, in some cases, we were waiting up to 7 days for a test result. So again, good news. In our schools, we have seen cases among school-aged children and school staff, but the number of cases remains stable and relatively low compared to last October and November. However, this is just a little concern for us. We did see a we would call it kind of an unusual and significant outbreak in a school classroom involving cases that were about 1/3 of the classroom. It also involved a teacher, and the outbreak extended to at least 2 families that were associated with the classroom. One of the individuals had to seek emergency medical services. Because it was a little unusual and larger than we usually see, we're usually able to contain it much quicker. We are sending samples to the state to test for the variant. Speaking of the variants, we continue to be concerned about them. There's just still not a lot that we know. We know that they spread much faster, and that can really impact all of the statistics that I've just mentioned: cases, hospitalizations, and deaths. We've had 437 cases of the B.1.1.7, which is the UK variant. In Michigan, over 14% of all B.1.1.7 cases identified in the US to date. No variant cases have been detected in Ottawa, but I would just mention that not all positive test results are tested for the variant. And we did request testing for the outbreak that we saw last week. So we'll keep you posted on that. Let's talk a little bit about vaccination. Ottawa County's vaccine allocation continues to increase slightly each week, with an average first dose allocation of 2,556 doses. And this is over the last 4 weeks. So we see this as positive. It's more than doubled since we were stuck at 975 cases or doses a week. So we feel really good about that. Also, last week, we received our first allocation of Johnson & Johnson vaccine, and we got 1,550 doses. It's unlikely that we didn't get another allocation this week. We may not get one next week, but we're hearing out of the governor's office that soon we will see a significant increase in Johnson & Johnson vaccine coming to our county and throughout Michigan. We've had a really good response to that vaccine. People are very interested in it being a single dose, and so we saw a real positive uptake when we were able to offer that to our residents. We continue to work closely with our hospital and pharmacy partners. We've been pushing out vaccine and holding large clinics, which continue to be at the Civic Center in Holland and the Meyer GVSU campus. We continue to get overwhelmingly positive feedback from everybody who comes through. We hear that it's well organized. I got in and out really quick. People were very friendly and very helpful. So I personally feel very pleased and I want to compliment the team that's been working out there. These are long days, long hours. It's a lot of work. A lot of care goes in, especially since we've been vaccinating our older adult population. They have needed a lot of extra support, which our team has provided. So kudos to all of them. Last week, I should also mention too, in addition to our hospital and pharmacy partners, we've tried to spread out the vaccine throughout the county. We've done clinics in Hudsonville, Grand Haven, through North Ottawa Community Hospital, and we've also worked with Mercy Health, and they're running a clinic with Shape Corporation. And that continues to go really well. We had one in Coopersville that also was a collaboration and went very well. I think people appreciated that we're spreading out a little bit, and we'll continue to try to do that. The state last week announced that they will allow the vaccine eligibility to expand to individuals 50 and over with chronic medical conditions. And parents and caregivers of children with serious health conditions. And then starting next week, all individuals over 50 may be vaccinated. And all of this, of course, is contingent on vaccine availability. So our vaccine clinics have continued to focus on the 65 and older and all of the priority groups and 1B. We feel like we're really making progress, and we've seen I would say a slowdown of our vaccine appointments filling. And when we see that happening, we tend to open up to the next category. And so this week we expanded our appointments to food processing, agriculture workers, and 50-year-olds with chronic health conditions. And so I'll keep you posted and let you know maybe next time how that's going. But our appointment schedules this week seem to be filling really fast. So how is all of this vaccination going in terms of what kinds of percentages of the population are we seeing being vaccinated? So among people 16 and older, which is the eligibility threshold for vaccine in Ottawa, 13% is completely vaccinated. That means they've either had 1 dose of Johnson & Johnson or 2 doses of either Moderna or Pfizer. That is slightly higher than Michigan, which is 11.7% overall. And also, that's fully vaccinated. It's also important to note that 21.9%, almost 30%, have had at least 1 dose, which means that they're in the queue for their 2nd dose and will soon be fully vaccinated. And that accounts for about 50,398 residents in Ottawa County. The completion among people 65 and older, 29.7% of Ottawa is completely vaccinated in this age group. That's slightly higher than Michigan again. 59% have received at least 1 dose, which again, I'm super proud of that. Almost 60% of our 65 and olders are very close to being fully vaccinated. Ottawa County has more work to do towards reaching health equity. We continue to work with our partners to invite them into our clinics, and we reserve appointments, and we do special outreach, calling. We're providing interpreters, we're providing information in a variety of different languages to make it easier. We provide help scheduling, and we will continue to work closely with our partners to make sure that we are creating equitable access to vaccine for all of our residents in Ottawa County. So this data is all good news, and it's actually led to more good news. Last week, the state issued new epidemic orders, and many of you have probably heard about those. They're effective through April 19th. These new epidemic orders are lessening some of the gathering restrictions in both non-residential and residential gatherings. Some examples, I won't go into all the detail. It's all available either on our website or through the state's website if you need more specific details. But examples include raising the capacity restrictions from 25% to 50% in food establishments and retail, as well as increasing the number that can gather outdoors and non-residential settings to 300. And we've already seen some real positiveness from this. I think our food establishments who have been hit very hard are excited about the ability to open up 50%. I'm excited to be able to go out to eat. We know that they're all doing a fantastic job of following the safety guidance, and I encourage you to safely go out. Still mask, still distance, still wash your hands a lot, but things are looking up and we are able to get out a little bit more. And we also have been working closely with Tulip Time. I know many people have been kind of monitoring that as that first big public event. They are going to have Tulip Time. It's going to be a slightly scaled down version of Tulip Time, but we again feel that with really working hard on keeping safety measures in place, they will be able to hold a safe event. The CDC also issued new guidance yesterday. This is primarily because authorized vaccines are proving to be highly effective at protecting vaccinated people against symptomatic and severe COVID-19, and because there's growing evidence that fully vaccinated people are less likely to have asymptomatic infection, meaning those folks that don't have symptoms but have COVID and could potentially be spreading it without knowing it. So therefore, the CDC is allowing fully vaccinated people to visit with other fully vaccinated people indoors without wearing masks or physical distancing. Visits with unvaccinated people from a single household who are at low risk for severe 19 disease indoors without wearing masks or physical distancing is also permitted. And these individuals who are fully vaccinated may refrain from quarantine and testing following a known exposure if they don't have symptoms. And just to remind you, people who are considered fully vaccinated when they are 2 weeks after they've received their second dose of either Moderna or Pfizer, or 2 weeks after they've had 1 dose of Johnson & Johnson. Fully vaccinated people engaging in social activities in public settings still must follow the guidelines put out by Michigan Department of Health and Human Services. So I know a few of you, I'll just wrap up with this. I know a few of you have received inquiries about discontinuing contact tracing and quarantine for school-age students, and I just want to talk a little bit about that. As many of you know, MDHHS and the CDC provide local health departments with the rules regarding contact tracing and quarantine. Typically, communicable diseases that are infectious, meaning they're contagious, before a person has symptoms, and those that can have high rates of morbidity and mortality require contact tracing and a period of quarantine for those that have been exposed and for those that are susceptible, because they, as I mentioned a minute ago, they could unknowingly be spreading the virus to others before experiencing symptoms. We know that it's very difficult in school to keep students consistently 6 feet apart during in-person learning and athletics. Some students had more than one exposure, and therefore they've had more than one period of quarantine. And this leads to understandable frustration. We always feel really bad about delivering the news to a student and a family member who has to quarantine for a second time. We get it, it's tough, but it is important. I want to say that overall, all of our schools, our students, our parents, our teachers, and all the people that work in the public school and private school sector should be commended. They have been working so hard this year, and it's becoming spring. We're making a lot of progress, but they have worked hard. They've followed the health protection rules, and they've done a fantastic job of ensuring a safe school environment. This has led to only small numbers of outbreaks in schools this year. And the most important thing about this is that because we've had small numbers, this has allowed students to remain in person learning in school. We've seen in other states where they've just completely shut schools altogether. I think as a community, as a public health officer, as a parent, as a person who really cares, I believe kids need to be in school, but they need to be in school safely. And so it hasn't been easy, and students have made sacrifices, as everyone throughout the pandemic. We're all tired of COVID. I understand this. It's been an undeniable, or there has been an undeniable impact on our entire population. But we just can't give up yet. We're on the home stretch. As I mentioned, our cases are coming down. More vaccines becoming available. Our most vulnerable people among our residents are getting vaccinated, meaning our older adults and those with chronic health conditions. But we're not completely out of the woods yet. I also mentioned just some of the unknowns of the variant that we're watching very closely as our state and federal partners. And we just need to remain vigilant a little while longer. So let's stay the course and let's work together a little while longer so that we can get back to living our lives and being safe and protected against COVID-19. So on that note, I will open it up to any questions that you may have. Doc is also on the line and would be happy to entertain any questions too.
Okay, we'll start with Greg here, and then I'll ask if there's any questions online on Zoom. Go ahead, Greg.
Lisa, you've mentioned it before, but could you tell our guests online the easiest way to sign up for their shot?
Yes. So if you go to myottawa.org, you'll see at the top of the page, there's a red strip. It says COVID information. You click on that. And then the next page will pop up and it says, I want a vaccine, in a red box. And you click on that and it will take you to a very brief survey. And That's how you can get signed up for vaccine. And we're really, Greg, I really, really appreciate you bringing that up, because I want to emphasize, we want everybody to sign up for that. That is going to be the fastest way for you to hear about a vaccine. Right now, we are working with a number of employers, and they're pushing out information, but this gets you in the queue. We've had great success with the outreach through the I Want a Vaccine button. So I encourage everybody to sign up.
Thank you. Okay, I think we have 2 raised hands. Justin, who are they?
One is a public comment, I believe, Mr.
Okay,
Chair.
all right.
So that would, yeah.
Okay, we'll take the public comment.
Are we ready for public comment?
No, wait a minute. No, we can't take the public comment. Okay, so what's the other one?
I only see one.
Doug
Okay,
has
I
hand.
thought I saw 2.
Oh, I'm sorry. Yeah, I see one right now. Maybe someone lowered it.
Okay. Any of the commissioners have questions?
I guess I still have one, Mr. Chairman.
Anybody here? Okay, go ahead.
Lisa, I know at one time, I think was a good goal, you talked about having 10,000 vaccines a week to meet Ottawa County's needs and everything. We're not quite getting there because you don't have enough vaccines. So
Correct.
what, and you must be talking to the Lansing, the people in the government, and there must be other counties that are struggling with this. When do they feel that the 3 big drug companies are going to produce enough so that we start knocking more people off on this? So, do you know?
I wish I had a really concise answer for you, and unfortunately I don't. However, we are hearing from the governor's office that more vaccine is coming. We are hearing that more Johnson & Johnson vaccine is coming. We should see a higher allocation by the end of the month. We also are hearing that we should be receiving a larger amount of the Pfizer vaccine. I haven't heard a lot about the Moderna, but we're certainly hopeful. And I also know that our federally qualified health centers, which we have one here in Ottawa County known as Intercare, they are going to get a direct allocation from the federal government. So it will be on top of what we get as a public health department. And we also know that some of our pharmacies are going to be getting direct allocations. So I don't always know what those allocations are. I know what the hospital gets, and I know our hospitals, and I know what we get. I don't know about the pharmacies or the FQHCs, but I can tell you that we are working very, very closely with both of those entities, and we are going to be working together to make sure that we are getting that vaccine in people's arms for those who really want the vaccine. So I think soon.
Okay. Thank you.
Joe?
Lisa, Commissioner Bauman, couple quick questions. The current vaccines that are out there, how are they doing against the variants? Do we have a lot of info on that yet, or?
Maybe I should defer to Doc on this. My information is very, very high level. Doc, do you want to speak to this?
Well, just a couple of comments on that. As far as the variants go, it looks like the vaccines are effective. At least this is what the CDC is saying, that they are effective. We are concerned a little bit about the South African strain. That's the B1351 strain, because that is one that does seem to possess an ability to sort of bypass some of the antibodies formed either from the vaccine itself or from a prior infection with COVID. But overall, they are still saying that the CDC thinks that this is effective. But just to add on to that, that Moderna and Pfizer are both looking at the possibility of sort of readjusting or tweaking their vaccine, or even to the point of having a booster. But as of right now, they don't feel that's necessary, and we'll have to see what happens as we see more and more of the South African strain, particularly.
One other quick question for you, Doc. The other day on one of the stations in Grand Rapids, they were interviewing an internist, and she basically made the comment that the new Johnson & Johnson vaccine
is if you get COVID, you're not going to die and you're not going to end up in the hospital. Is the Johnson & Johnson vaccine that much better than the other two?
No, that's a good question, though. The Johnson & Johnson vaccine in their clinical trials was very effective as far as preventing serious illness, particularly hospitalizations and deaths. Again, these are in their clinical trials. It's hard to compare these vaccines because, first of all, they were not head-to-head trials. They were done at different times and in different places. The Johnson & Johnson vaccine did a lot of their clinical trials in South Africa, where they have the South African variant. And so from that standpoint, their initial results may not have been as impressive as far as preventing disease, but it's proven to be very effective as far as preventing hospitalizations and death. Much like, if you get the flu, if you get the flu vaccine, you might still get the flu, but it's going to be a mild case. And this is pretty much what the Johnson & Johnson vaccine is bringing to this particular part of the pandemic.
Thank you, Doc.
Anyone else? Frank?
Lisa or Doc, I know that the CDC hasn't put out any travel guidelines yet. Are you able to give an indicator about how safe it is based on, or when the CDC would put out some guidelines for traveling? And if we are traveling, what precautions folks ought to take?
Well, actually, right now, they're still saying don't travel.
Okay.
That's pretty much it. They say don't travel. They're concerned about spring break right now. People going to Florida, going to Mexico. Doesn't matter right now where you go. They're just saying don't travel, stay home, have a staycation rather than a vacation this year.
Okay. And for those who do insist on traveling?
Well, as far as as before you go, I think Lisa's already talked about a lot of that. The old things about social distancing, wearing a mask, washing your hands. There is a recommendation if you're going to be traveling outside the country when you come back. They are saying it's preferable to stay home, sort of go into self-quarantine, but this is not a requirement or anything like that. But that is a possibility, even to be tested. But again, these are just recommendations. They are not requirements.
Okay, thank you.
All right, anyone else?
I think
Got
we,
one.
Yep, I see that. Randy, go ahead.
There, I figured out how to mute myself, sorry. Lisa or Dr. Heidel, just quick question. All the vaccine that we're receiving, are we getting that in arms, or is there any are we having any issues with extra vaccine that we can't get rid of or whatever? I'm just curious.
we have been able to administer every single dose that we have received.
Okay.
And I know there's been news about, end of day vaccine. Well, we have a list of people that we call at the end of the day. They can be there in 15 minutes and we vaccinate every one of those people too, I have to say, have been within the prioritization criteria too. So we've been really working hard to stay within that framework. I'll be honest, it's going to continue to get a little bit more difficult as we open it up for a variety of reasons, but
Sure.
we're making sure that the most at risk get it first.
Okay, great, thank you.
Mhm.
Anyone else?
If I could just add a couple things here.
Sure.
You're wondering about the vaccine supply. Just to let you know that AstraZeneca is planning on applying for the emergency use authorization of their vaccine next month. And if it's approved, they feel that they can immediately release 30 million doses of vaccine out there. So, I mean, that's something to look forward to. Also, the experts are saying or predicting that perhaps as early as this fall, if clinical trials go the way they anticipate, that high school students may be able to start getting the vaccine this fall, and that grade school children maybe by the first of next year. So these are a couple things we're looking forward to. Again, this is all just speculation right now, but this is what they're saying. This is what they're hoping, and obviously that would be a big boost, both of those things.
Okay, anyone else?
May I just add one quick thing? I forgot. I have a little sticky note with a notice. I just want to remind everybody, because we've had a number of calls. So the guidance for Pfizer and Moderna is that for Pfizer, you have 21 days between vaccinations, first and second dose, and for Moderna, it's 28 days. For a variety of logistical reasons, it is very difficult for us to toggle back and forth between these two vaccines. And so the CDC, as well as MDHHS, and the producers of the vaccine all agree that it's fine for us to move to a 28-day for both Pfizer and Moderna. So for people that go in and get their vaccine and they sign up for their appointment number 2, there is always going to be at least 28 days between vaccines, regardless of whether it's Pfizer or Moderna. And that is perfectly acceptable. It's just as effective, and it's all gone through the authorities to ensure efficacy and safety.
Good. Thank you, Lisa. Thank you, Doc.
Thank you.
Yep. And looks like we can move on. The next thing on our agenda is public comment. This is one of 2 times anyone can address the commission. We ask that you give us your name and address and speak for 3 minutes. Go ahead. You go ahead first.
Good afternoon. My name's Shannon Donley, 15857 Brucker Street in Grand Haven. Last year, we just coming off the COVID report here. Last year, a group of us got together, and after 4 years of driving to the southeastern side of the state of Michigan, we said the lakeshore needs to step up and say, hey, we're here too when it comes to water. And so in order to celebrate World Water Day, kind of Earth Day's unknown little brother or sister, depending on how you look at it, we've decided we started working on the Lakeshore World Water Day Festival. Last year, it spanned Muskegon and Ottawa counties both. We had events planned, and then we went on lockdown, and we all cried for all the work that we'd done. But it's back, and we're back. And back in November, we started figuring out how do we do a safe and healthy and socially responsible event. And so we've tweaked our events. We've moved most of them outdoors or online. And I just wanted to share with you that the goals of the celebration are to celebrate the Great Lakes, not just our lakeshore, not just Detroit and Flint as they get back on their feet, God willing, but also our Great Lakeshore. And we also need to bring awareness that as global citizens, we have a big responsibility to care for and be stewards and good stewards of 5% of the world's fresh water. We're inviting spiritual leaders, community leaders, musicians, youth groups, everyone we can to come together for this event. You all have access, hopefully those online will too, to what we put out for the press release. And I just wanted to share with you, we've added a couple more things to the events. One is an online auction starting Friday, March 19th. I have a lot of things that have been donated to our groups, and then I'm just letting that thing run through the weekend of the 20th and 21st. Pancakes over pipelines and PFAS at Grand Haven State Park. I had
Haven
to-
Central Park?
In Central Park, yes.
Central Park, okay.
In Grand Haven. St. John's Episcopal Church has a commercially licensed kitchen. They are letting us, with their social guidelines in place, use their facilities to actually prepare food. Our runners will be using hot boxes to bring them over individually in individual serving containers so that there won't be any intermingling of silverware and whatnot. Everything will be biodegradable. So we'll have a 0 footprint over there in the park. And so we're looking forward to that. And then we'll be walking from Central Park down our beautiful sidewalks out the boardwalk to Grand Haven State Park for a Native American water ceremony, as well as a all hands on deck beach trash bash. Right now, it looks much better out there than it did in 2020. We haven't had the erosion, knock on wood, that we had last year. But there's still a lot of man-made materials that don't belong on our beachfront. So we'll be doing the trash bash after our water walk. We've added a virtual viewing party. And we've got two short documentaries and one longer documentary that's not listed called Necessity.
We do have our 3-minute time limit.
Okay.
And
And then Sunday we will have the We Speak for the Water Forum. So I'm inviting all of you to participate. You're more than welcome to, if you'd like to contact me, my information is there about speaking at any of these events, or just come on and enjoy the pancakes. But you're more than welcome to join us. So thank you for your time. Do you have any other questions?
Do we have anyone else that'd like to speak to? No, I think you're good. That's good.
Okay, thank you.
Thanks. We have anyone else that would like to speak to the commission at this time? If not, do we have anyone online?
we do, Mr. Chair. We have 3 individuals.
Okay.
And the first one, I just asked if you would state your name and address for the record.
Hey, this is Tracy Reed, and I live at 14276 Virginia Lane in Grand Haven. And I am so pleased to be watching this. This is the first one that I have joined, and it's so informative, and you guys do a really nice job. And I want to just say kudos to all of you for that. And I wanted to ask, I've been trying to get a little bit of research on Ottawa County specifically, and it was wonderful to hear Lisa talk about all of the progress being made with regard to COVID. I am wondering, I've been online and I'm able to find statistics for the state of Michigan and the total deaths year to year. But is there a place where we have aggregated, and it might be on your site, I have just not been able to locate it, where we have aggregated the deaths for Ottawa County annually over the last 3 to 5 years, so that we're able to maybe get an understanding of those related to COVID? So I'll stop talking here and await your response. Thank you.
Okay, so we got her address, right? We've got
That's
her address,
correct.
so someone could respond.
And
to
we
that.
can, Ms. Reed, if you want to hang on the call for just a minute, we can also get your email if that's easier as well.
Okay, perfect. Thank you.
Okay, who's next?
Next is Lene M. And again, if you could just state your name and address for the record.
Hello, Lene Monera, 6722 Pierce Street, Allendale. Good afternoon, commissioners. My comments are in regards to the health department's continued contact tracing and forced quarantines of our healthy school-age kids. My intent is not to come off as sounding insensitive, because I know COVID has resulted in deaths. But if you look at the Ottawa County website, they have COVID-19 demographics, I'm sure you're aware. And there's a graph for COVID-19 cases showing that the average death of a COVID-19 case is over 80 years old. In fact, the average is 80.57. Another relevant graph to my comments is the one labeled percentage of deaths by age group, which shows there have been 0 deaths for ages 0 to 9 and 0 deaths for ages 10 to 19. Which is great. But given this data, my question is, why is the Ottawa County Health Department still mandating that our school kids quarantine themselves for 14 days, miss in-person school, because next to the kid who tested, likely response is going to be, well, our Ottawa County Health Department has to comply with the MDHHS orders. But if you look at the language of the orders, there's actually some discretion built into them. Paragraph 10B states in part, quote, local health departments are authorized, again, are authorized to carry out and enforce the terms of this order, end of quote. Are authorized means are allowed. This part of the mandate does not say health departments must, are required to, or shall carry out the terms of the MDHHS order. Another part of the recent order dated March 5 at paragraph 9D says, upon request, schools must provide names and phone numbers of individuals with possible COVID-19 exposure to the health department to aid in contact tracing. So again, it says upon request. Respectfully, how about our health department stop requesting and start exercising the discretion that it has under these orders? Stop forcing schools to report close contacts. Stop forcing healthy kids to stay home from school for 2 weeks because they sat next to a positive COVID case. Commissioners, all of our lives, we've sat next to kids in school that have had the flu, they've had strep throat, but we didn't have to stay home. Why is COVID-19 different? Is it different? The quarantines and isolation are wreaking havoc on our kids' education and their health, mental and physical health. And for what? For a disease that, according to Ottawa County's own website, has resulted in 0 deaths of kids from birth to age 19. Thank you.
Thanks, Lynn. Who's next?
Oh, I just made it in. I'm like,
Teri Wynn. And Teri, if you would just state your name and address for the record.
Yes, hopefully you'll be able to hear me. I live at 7610 Hidden Lake Drive in Hudsonville, Michigan. I very much have enjoyed listening as well today. I want to identify myself as a healthcare professional. And so with that, I want to proceed. In March of 2020, with an unknown virus, schools were closed down in Michigan, forcing our kids into a new state of isolation. In the fall of 2020, many of our Ottawa County schools were instructed to have a plan to safely enroll bring students back into the classroom. During this academic year, hundreds and hundreds, and I might even guess thousands of kids have been forced into quarantine due to classroom exposure. We are now sitting here in March of 2021. We know more about this virus than we did last year. In fact, we know much more than we did last fall in July and August as we were preparing these safe return plans. We have FDA approved treatments. We now have 3 vaccines, and yet our Ottawa County Health Department has not deviated from these plans. We have already heard today, Lisa gave a great overview of Ottawa County data showing our local community cases. We call this in healthcare community positivity is very low. So it is time for us to follow the science, the data. My son is now in quarantine for the 3rd time this year. This has resulted in 6 weeks of social isolation, 6 weeks of lack of high school education where his high school is fully in person. With this 3rd quarantine, I asked my high school administrators to report to me the data, the number of students, which has been hundreds that have been quarantined, how many have resulted in a positive case of COVID. Their response very quickly was 0. Let me just state that again, 0. Yet we have a new crisis rising among our teens. Are you aware that the CDC estimates 1 in 4 people under the age of 18 has struggled with suicide ideation in this last year? A recent publication in Pediatrics, which is a scientific journal for the American Association of Pediatricians, identifies that teen suicidal ideation is statistically significant in the last year as compared to previous years. Quarantining of our healthy children for classroom exposure is no longer an option. We have a rising crisis among us. Cases of suicidal attempts have doubled and tripled at our local children's hospital in Grand Rapids. It is time for Ottawa County to pivot in their response. All other Michigan Department of Health and Human Service orders have been revised. We have opened restaurants, stores, entertainment venues, and yet this protocol has not changed in our school. Why? Community cases are low, businesses are opening up, yet our kids have continued to suffer at your
Thank you, Teri.
Time has expired.
Thank you, Teri. Anyone else?
Not at this time, Mr. Chair.
All right, thank you. The next thing is approval of the agenda. I'd like to propose a couple of changes. First of all, under administration, number 3, Aaron is not available, so we're going to take that off the agenda. And under discussion items, I'd like to move up the report from the county administrator to the first thing under discussion items. So it'd be number 1 under discussion items. And then Ottawa County Department of Health is number 2. State University is not available. So then it goes down from there. So with that, can I get a motion to approve the agenda, please?
Make that motion.
Support.
Comments or questions? Please, Justin.
Yes, sir. Mr. Dannenberg. Mr. Baumann.
Yes.
E.
I vote yes.
Mr. Meppelink.
Yes. Sorry, yes.
And Mr. Terpstra.
Yes.
Mr. Garcia.
Yes.
Mr. DeYoung.
Yes.
Mr. Holtvluwer.
Yes.
Mr. Zylstra.
Yes.
Yes.
And Mr. Bergman.
I vote yes.
Motion passes.
Thank you. Next thing is consent resolutions. Mr. Fenske.
Thank you, Mr. Chair. I would like to make the motion to approve consent resolutions 1 through 3.
Support. Been moved and supported. Comments or questions? Justin, would you call the roll, please, and ask you guys to say more than just yes, okay? Please?
Yeah.
Okay. Thanks. Go ahead.
All right, Mr. Garcia.
I vote yes.
Mr. Baumann.
Vote yes.
Mr. Zaf.
Yes.
Mr. Dannenberg.
I vote yes.
Mr. Meppelink.
I vote yes.
Mr. Terpstra.
Yes.
Mr. Holtvluwer.
I vote yes.
Mr. DeYoung.
I vote yes.
Mr. Kyers.
I vote yes.
Mr. Bergman.
I vote yes.
And Mr. Fenske.
I vote yes.
Motion passes.
Thank you. Public hearings, none. Action items from administration. Phil, would you take number 1, please?
Yes, thank you, Mr. Chair. Number 1, a lease agreement with the Historical Ottawa Beach Society, and the motion is to approve and authorize the board chairperson and clerk register to sign the lease agreement with the Historical Ottawa Beach Society for the use of the pump house building at the Historic Ottawa Beach Parks through March 31, 2041.
Support.
Been moved and supported. Comments or questions?
Isn't that a long time? 2041? I mean,
If you recall, when the building was rehabbed, it was, half the building was designed to be for this purpose. So they have had it under lease since that time. So I
Okay.
think it was built into the permanent design of that facility. But Jason, if you have more, you're welcome to chime in.
Yes, so, and this is a renewal and extension. So they are, have taken on the ambitious goal of fundraising to do some additions and renovations to that building. And they felt like this extension would offer them better ability to kind of meet the needs of the funders. So we think it's been a great partnership. They're doing regular programming there, as well as have some incredible exhibits. So it's worked well.
so we won't vote on this again for 20 years.
Correct.
Okay.
Somebody won't.
Somebody will.
Time to vote on it, Al.
Yeah, it's gonna be a lot of time.
So Jason, they're putting this addition on at their cost.
Yes, so, and there was in your packet a rendering of it, but the plan would be, as they do the fundraising, when they reach their fundraising goal, they'd coordinate with us. The Parks Commission would approve any designs, as well as any naming rights or recognitions. And then we would build it, kind of own the construction project as a county project, and work with them to get the design as they wish.
Good, thanks.
Jason, it's my understanding, but this is an indefinite process that 20 years from now, that it'll probably be another 20-year extension and 20 after that. And
correct.
Okay.
Correct.
Any other questions? Thanks, Jason.
Welcome.
All right, Justin, would you call the roll, please?
Yes, sir. Mr. Kyers.
I vote yes.
Mr. Holtvluwer.
I vote yes.
Mr. Garcia.
I vote yes.
Mr. Dannenberg.
I vote yes.
Mr. DeYoung.
I vote yes.
Mr. Zylstra,
Voting yes.
Mr. Terpstra,
I vote yes.
Mr. Link,
I vote yes.
Mr. Baumann,
I vote yes.
Mr. Fensky,
I vote yes.
and Mr. Bergman.
I vote yes.
Motion passes.
Next thing is Ottawa County Department of Health and Human Services Annual Report. Mr. Dannenberg, would you call that one, please?
Yes, I'd like to make the motion to receive for information the Ottawa County Department of Health and Human Services 2020 Annual Report.
Support. It's been moved and supported. Comments or questions? Justin, would you call the roll, please?
Yes, sir. Mr. Garcia,
I vote yes.
Mr. Fensky,
I vote yes.
Mr. Zylstra,
I vote yes.
Mr. Dannenberg,
I vote yes.
Mr. Terpstra,
I vote yes.
Mr. Meppelink,
I vote yes.
Mr. Wolflor,
I vote yes.
Mr. Baumann,
I vote yes.
Mr. Kyers,
I vote yes.
Mr. DeYoung,
I vote yes.
Mr. Bergman.
I vote yes also.
The motion passes.
All right. Joe, would you take number 4? Joe
Sure.
Bala?
Thank you, Mr. Chairman. In regards to the Ottawa County Innovation and Technology 2020 Annual Report, I make a motion to receive for information the Ottawa County Innovation and Technology 2020 Annual Report.
Support.
It's been moved and supported. Comments or questions? Justin, would you call the roll, please?
Yes, sir. And Mr. Chair, if you wish, I think these can be voice votes as well.
All right, all right. So all in
Totally up to
favor?
you.
All in favor, say aye.
Vote yes on that.
Aye.
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 Okay, all right. Number 5, Frank, would you take that one, please?
Yes, Mr. Chairman, I'd like to make the motion to receive for information the Ottawa County Community Action Agency 2020 Annual Report.
Support.
Been moved and supported. All in favor, say aye.
Aye.
Oh, same sign. All right, thank you. Okay, under appointments, we have none. Discussion items, first thing is the 2020 State of the County. Go for it.
Thank you, Chair Bergman, Vice Chair Fensky, and the Board of Commissioners for this opportunity to present the 16th Annual State of the County Address. It is an honor to share the highlights and challenges of 2020, as well as a glimpse into the future. Ottawa County continues to excel and stand out as a leader among local governments in Michigan. Our vision to make Ottawa County where you belong, a place where all people, visitors, and businesses feel welcomed and valued as vital threads of the community fabric. On January 30th, 2020, the World Health Organization declared a global health emergency for the COVID-19 virus, and Michigan saw its first 2 cases in March. Preparations by Ottawa County government and the Public Health Department had already begun in expectation of spread to West Michigan. On March 24th, 2020, in accordance with Section 10 of 1976 PA 390, the Ottawa County Board of Commissioners declared a local state of emergency to ensure quick and efficient response to the public need. The declaration opened up the response and recovery elements of the county's emergency operations plan and provided agility with staffing and emergency purchases, all crucial to an efficient response. The response effort included strategies to reduce transmission among staff, protect people at higher risk for adverse health complications, and striking a balance between the maintenance of essential and the necessary governmental operations, services, and minimizing the spread of the virus and the negative impacts to county residents. As the pandemic grew, testing, contact tracing, quarantine, and isolation and vaccination dominated efforts and continue to do so. To date, Ottawa County has continued its state of emergency 4 times, each has been for 2 months, and is currently in place until March 23rd, 2021. On May 7, 2020, Ottawa County Emergency Management also declared a state of emergency due to inland flooding near the Grand River. Recent census reports indicate that 291,830 people choose to call Ottawa County home. From 2010 to 2019, Ottawa County's population increased by 10.6%. the fastest growing county in the state, and still the 8th most populous county in Michigan. Over 50% of Ottawa County's population growth resulted from migration to the area. The non-seasonally adjusted unemployment rate for Ottawa County was 3.7% in December 2020, third lowest unemployment in the state of Michigan. Since 2010, residential building permits have increased by 188%. The taxable value on the ad valorem roll increased by 5.42%. The general fund operations tax levy and the total of the operations levy and all special millages place Ottawa County as having the 5th lowest property tax rate of Michigan's 83 counties. Ottawa voters approved a tax limitation proposal in the general election that will freeze the millage allocation for 10 years. This action also reset the county operating millage to 4.440. In 2020, the Heidel rollback reduced the maximum allowable millage from 4.186 to 4.3814. The Board of Commissioners continued to levy 3.9 mills, committing 0.3 of a mill to pay down the unfunded liability from the closed defined benefit plan. After the Heidel rollback and committing a portion of millage, the board levied 0.4814 mills, or $6.2 million less than the maximum allowable that the board could levy. The financing tools, a series of funds designed to smooth the impact of one-time expenditures on the general fund, saved taxpayers another $1.3 million in 2020. Prudent cost allocation activity passed $2.5 million of expense to state and federal grant programs. The result of all this financial activity is a strong financial position. Ottawa is one of 4 Michigan counties to hold 2 AAA credit ratings. These top scores allow Ottawa County, plus its local units of government, to borrow money for capital improvement projects with lower interest rates, saving taxpayer dollars. 2020 was a record-breaking year in many ways for the Register of Deeds office, with the foundation being laid in 2018 and 2019 as they increased the number of documents being recorded electronically by a significant margin. Online recording of land records is more secure, more transparent, and also offers a quicker turnaround time for customers. While they have seen a steady increase in electronic recording of documents over the past few years, 2020, not surprisingly, saw the largest jump. 79% of all transactions were electronic in 2020, representing a 12% increase over 2019 and a nearly 44% increase since 2017. Electronic recording proved a critical element in allowing the Register of Deeds office to function at full capacity during the height of the COVID-19 shutdown, including periods where other counties were not recording documents. While they continued to accept documents recorded by mail, utilizing in-office team members, staff working from home were also able to securely accept electronic transactions, check for accuracy, index, and officially record documents. This resulted in over 10,000 more transactions in 2020 than in 2019. That's an increase from 49,256 to 59,922. The Register of Deeds office received over $2 million, almost $2.1 million to the general fund in 2020 in county transfer tax alone. With nearly a full year of data now available for the work from home model, the Register of Deeds office has actually seen an increase in productivity and accuracy from March 1, 2020 to March 1, 2021. IT has begun to refresh the county's network with improvements to Wi-Fi capabilities. Significant strategic security improvements to both network and users have been deployed. Office 365 has been deployed to most of the county employees. Engagement with Office, OneDrive, Teams, SharePoint, and BI, which is business intelligence, are occurring. A user group has been established and meets to share how departments are leveraging these tools. The county continued its goal of updating county facilities, including the renovation of the Ottawa County Health Administration and Environmental Health Office with furniture and lighting in an open space concept. In addition, COVID-19 thrust facilities into the spotlight by stepping up efforts to ensure that all county facilities were cleaned and sanitized on a regular basis. Plexiglass barriers were installed to provide additional protection to employees, and with the considerable assistance from IT, equipment was updated to allow most meetings to be conducted virtually, in an effort to control the spread of the coronavirus disease. The county negotiated an integrated project delivery IPD agreement with Granger Construction and DLZ Architects to design and construct the new Family Justice Center, which is a courthouse that will house juvenile court and friend of the court in the same building at the Fillmore Street complex. This newer building method, in which the contractor, architect, and key subcontractors work together from day one on design and construction of the building, will result in a new building that will meet the county's needs for many years to come at less cost than traditional building delivery methods. This project could likely represent the first true IPD in the state of Michigan. The county also provides strategic planning assistance, election support, training, and many other services and opportunities to local units of government. Intergovernmental, intersector collaborations will remain an area of growth for the county in future years. In addition to provide assessing services for the city of Grand Haven, Blendon Township, and Crockery Township, the county entered into a 2-year agreement to provide assessing services for the city of Hudsonville in 2020. 2020 was a challenging year for the Ottawa County Sheriff's Office and for law enforcement nationwide. With a global pandemic, community tensions, and uncertainty, there were no policies or guidebooks for the ever-changing COVID-19 issues and the multitude of changes that were commonplace throughout the year. Calls for service decreased during the initial onset of the COVID-19 shutdown. However, the Sheriff's Office did see an increase in domestic violence and fraud incidents in 2020. The Sheriff's Office reviewed and adjusted operations to meet the ever-changing challenges of 2020, all while continuing to provide professional and quality law enforcement for victims of crime and citizens. The Sheriff's Office also made successful changes in the jail operations to provide a safe environment for the employees and citizens housed in the facilities. 90% of the policies and procedures have been updated for the road patrol and jail, with completion of the remaining 10% expected in March of 2021. Interestingly, a couple of those changes included adding a robot in both the jail and the juvenile facility that cleans those facilities. And studies have shown that it actually cleans them more effectively with increased sanitation over having humans do that cleaning. The Sheriff Reserve Program and the Sentence Work Abatement Program, both highly successful and popular in their day, were eliminated in 2020 due to the external factors of limited staffing and increased liability. Hiring during the past year was also a major focus. The Sheriff's Office saw several retirements and welcomed the addition of 3 lieutenants and clerical staff. In December of 2020, the Sheriff announced that the agency would begin the complex procedure to become accredited through the Michigan Association of Chiefs of Police. After many years of advocacy, Community Mental Health of Ottawa County finally saw an increase in more equitable Medicaid funding in 2020. This, along with a revised distribution of state general fund dollars over the past 5 years cumulatively, significantly improved CMH's financial status as well as stability for the Lakeshore Regional Entity, the LRE. Millage funds and several new grants allowed CMH to expand services to more individuals and to provide a wider safety net system in Ottawa County. As essential health workers, CMH staff continuously provided services to consumers. The pandemic forced CMH to quickly adjust the service delivery model. Teams successfully implemented most of their programs via telehealth since March of 2020. The public mental health design effort that was recommended by MDHHS in 2019 was placed on hold due to the focus on COVID-19 issues. It is unlikely that the future redesign efforts will include major changes to the system. However, there will be increased emphasis on accessibility and integrated health and accountability. Across the county, broadband service remains inconsistent, and this was highlighted dramatically with so many people sent home to work and also children sent home to conduct their school activities from home. To improve internet access for everyone, the county initiated a new comprehensive digital inclusion strategy. This 4-phase plan seeks to establish affordable broadband access across all areas of the county and eventually West Michigan as a whole. Staff is on the cusp of selecting a vendor to spearhead data collection to determine the status of broadband service and future demand. This will aid in the design and planning for an expanded broadband network to be built in anticipated conjunction with broadband service providers. Ottawa County continues to address groundwater quality and quantity issues with the Groundwater Sustainability Initiative. In early 2020, the Proactive Strategies Index was adopted by the County Board of Commissioners. Many of the strategies within the index were swiftly put into motion. In October, county planners installed the first of many well monitoring systems to offer real-time observation of aquifer conditions and fluctuations in water levels. This data will be invaluable for long-range decision-making with respect to balancing continued growth and development in the county with available natural resources. County planners also released an educational paper titled Rethinking the American Lawn, which explains the benefits of native plantings as an alternative to the traditional water-intensive turf grass. Affordable housing continues to be a challenge in West Michigan, so the county reinitiated and relaunched the Ottawa County Housing Commission in early 2020. The commission was recognized by HUD as an official public housing agency, which will allow the county to secure funding and project-based vouchers to help facilitate the construction of more affordable housing options in the future. The commission effectively partnered with multiple entities, including Housing Next, Lakeshore Housing Alliance, and Good Samaritan Ministries. Through grants and programs, Ottawa County continued to seek innovative ways to spur economic growth while reviving blighted or other underutilized properties. In May of 2020, the county beat out 280 communities across the nation for a $300,000 EPA Brownfield Redevelopment Assistance Grant. These funds, promoted by the Ottawa County Brownfield Redevelopment Authority for environmental site assessment and cleanup planning, have already facilitated 8 assessments and planning activities on 4 project sites. Since creating the Brownfield Incentive Program back in 2019, the Brownfield Authority has supported 4 redevelopment projects with an estimated capital investment of $6.75 million and has assisted 2 additional sites that are seeking developer interest. Additionally, the Brownfield Authority began capturing taxes on its 5th Brownfield Tax Increment Financing Plan. This TIF supports a multi-million-dollar redevelopment project expected to bring 75 new jobs to the village of Spring Lake. Ottawa County's Farmland Preservation Program protects a storied local industry that employs well over 9,000 people. 2 farms were added to the preservation portfolio this past fiscal year, 168.2 acre Chester Township parcel owned by Jim Klein, and several parcels owned by the Kreidoff family totaling 148 acres in Wright and Chester Townships. 2020 was also a big year for farmland preservation applications. The 2020 application period closed with a record 9 submissions totaling 773 acres from 5 different townships. Fundraising and outreach are vital to the success of the Farmland Preservation Program. COVID-19 derailed many events in 2020, but not the county's premier farmland preservation fundraiser and chefs competition. Farms are the tapas. With the public safety in mind, the Agricultural Preservation Board and Farmland Preservation Program staff adjusted the format by partnering with an online auction and ticketing site, Event Gives. Through this web portal, the county sold tickets and ran a virtual silent auction. Despite lower total attendance due to COVID, the event raised $19,136 more than, $19,136, which was $611 more than 2019. The county continued to improve and expand its non-motorized recreational trail network. After successfully securing funding from the Meyer Foundation in spring of 2020, the 4.2-mile Spoonville Trail project pedaled its way toward the finish line. This brand new paved pathway safely guides cyclists and walkers over the MDOT 231 Grand River Bridge crossing, hugs the picturesque Terra Verde Golf Course, and ends in Nunica where it connects to the North Bank Trail. A cornerstone north-south connector in the county's trail network, Spoonville Trail enhances recreational projects for all. During the pandemic, it was clear that the community reconnected to nature, venturing outdoors more often. Parks in Ottawa County and across the nation became essential to coping with the stress of the unknown. Google mobility data supported this observation, reporting increases in visits to parks in Ottawa County of over 450% during spring and summer months in 2020. Ottawa County Parks welcomed the large influx of visitors, acting quickly to reduce overflow parking, implement one-way trails, and create signage and media in order to minimize overcrowding. The increase in park visitation was obvious along the Lake Michigan Coastal Greenway, with annual motor vehicle permit sales reaching over $500,000. This supplemental revenue to the parks millage will be important not only to offset lost proceeds on facility reservations and program fees, but also to address the effects of rising lake levels on our lakeshore landscape. High water levels force the removal of wooden access structures at Rosie Mound, Tunnel Park, and Kirk Park. Debris in the form of lumber continues to wash up on public beaches after every storm. In a collaborative effort to manage debris on Lake Michigan beaches and the Macatawa River watershed, Ottawa County Parks and Recreation formed a partnership with the Macatawa Area Coordinating Council and 5 other West Michigan partners to formally create the Lakeshore Cleanup Coalition. This group hosted cleanup events in the Macatawa Greenway and along the lakeshore where community members assisted with debris removal. A formal master plan design process was completed for Ottawa Sands, a recent $11 million property acquisition connecting thousands of acres of public land in the Grand Haven area. While major improvements are many years in the future, this park has a potential to be a recreational hub along the Lake Michigan coastal corridor, as well as the Grand River. Further south along the lakeshore in Holland, the first full year of operation at the Ottawa Beach Marina on Lake Macatawa was successful. Efforts by Macatawa Greenway partners continued to identify the next phase of the Greenway project. This included work to acquire additional properties to accommodate route connections along the Macatawa River, as well as working with key agencies to determine the feasibility of permitting trail access across key infrastructure barriers. These efforts are expected to be ongoing in 2021, with some hope for new acquisitions in the first of the year. The Bend area open space in Jenison, a critical property in the Grand River Greenway, was expanded not once, but twice to 421 acres. Progress on a key feature of the Greenway, the Idema Explorers Trail, continued with the completion of a segment of trail connecting the Jenison Business District to the Bend area, as well as a $300,000 Michigan Natural Resources Trust Fund grant award to complete the crucial connection between the Ottawa County Trails and the Kent Trails in Granville. In addition to trail construction and planning, efforts in park restoration are also completed at one of Ottawa County Park's oldest properties, Riverside Park. Nearly 1,000 feet of Grand River shoreline was armored to protect from erosion. Both user access and bayou connectivity were also improved. The Nature Center, located at Hemlock Crossing County Park, celebrated its 10th anniversary. While there wasn't a large gathering as planned, staff was able to adapt to new COVID-19 restrictions and continue to provide nature programs and activities to people of all ages, both in person and online. At the end of the year, the Ottawa County Parks Foundation announced their expansion of support to include community engagement and nature education. In 2020 alone, the foundation secured pledges for over $600,000 for parks projects, including the Grand River Greenway. The county continues to make progress in promoting a creative, innovative, and problem-solving culture through fostering Toyota Kata lean and design thinking methodologies. Public health continued to use scientific thinking to approach innovation throughout the pandemic. Ottawa County Community Mental Health is applying Kata in multiple programs, including the Access Center, which has made progress toward the goal of scheduling all psychosocial assessments within 14 days of the request and completing in under 200 minutes. OCC, Ottawa County Mental Health, also used Kata during the application submittal process to qualify as a certified community behavioral health clinic, CCHB, yet another acronym for governmental use. This provider will receive state funding for a total of $4 million per year for 2 years. Community Mental Health will utilize the CATA framework in collaboration with the Lakeshore Regional Entity to determine disparity and gaps in services based on population served. OCCMH will teach CATA and coordinate experiments with the 5-member LRE work group, 5 additional CMH organizations, and 7 counties. 3 additional skill development trainings occurred in 2020 with 15 CATA learners and coaches. A cross-departmental team of 5 internal second coaches was created to meet with teams monthly. CATA efforts were recognized annually by leadership and the Board of Commissioners. Human Resources and the County Administrator's Office collaborated to deliver a virtual in-person creativity training, introducing CATA and design thinking to 8 additional county staff. Training participants learned the 6 Thinking Hats tool and familiarize themselves with other resources in the online creativity playbook. The playbook is a resource that allows users to download various tools with instructions. A CATA e-learning training was also developed and piloted by 21 staff to share a fundamental knowledge and create awareness and excitement toward applying it to all daily work. An internal team used design thinking plays to construct and furnish an innovation room or design center. It was created as a unique, fun space to fuel activity. This space will be used by teams learning and applying CATA and design thinking to their work. We are really looking forward to touring that with the board once we have some of the COVID restrictions gone and we have more folks back to work. The county and the Michigan Lean Consortium co-hosted a blending design thinking and CATA workshop with 17 county staff attending. Participants learned about new problem-solving methods and design thinking tools that can be applied to daily work. During the fiscal year 2020, $3,008,000 worth of services were transacted through the county's online services. By saving time required for over-the-counter transactions, online services provide an additional cost avoidance benefit. This saves time for customers as well as allows access at a day and time convenient to them. In 2019, the number of online transactions totaled 90,678. In typical years, Ottawa County charges a convenience fee for online transactions. Because office visits were restricted due to the COVID-19 pandemic, this fee was waived beginning in April 2020. As a result, the convenience fee revenue was down 43% over the fiscal year, or $58,000. Transparent communication was a priority for both Ottawa County and for residents in fiscal year 2020. One of the primary avenues Ottawa County communicated was through GovDelivery, an email subscription system that began in July of 2015. The system allows subscribers to choose to receive news from over 200 different county topics and receive those messages daily or weekly. At the close of 2020, a total of 46,605 residents were subscribed to receive news from Ottawa County, an increase of 8,467 from the close of fiscal year 2019. Last year, more than 2.9 million e-bulletins were delivered to subscribers. The number of subscribers skyrocketed since January 2021 as residents rushed the county for information about COVID-19 vaccine. Okay, I'm going to go off script just for a second to say we have over 104,000 subscribers now. So we more than doubled, and they also subscribe to a lot more than just the COVID-related things. So subscriptions also went up significantly. I deviate from script only to say these numbers are going to look really weird to you next year when we do the state of the county. So that's why. In 2020, the Ottawa County Art Trust held its 3rd juried exhibition demonstrating the importance of creativity and culture to Ottawa County while preserving a legacy of assets for generations to come. A total of 46 entries were submitted to the exhibition by artists who live or work in Ottawa County. Of those entries, 11 works were selected and are now part of the permanent collection. Zen City proved to be an important new tool since its implementation in the spring of 2020, measuring feedback from a resident's perspective during the pandemic. The application collected thousands of resident-generated data points from a multitude of external and internal sources like social media, local news channels, and more. With the use of advanced artificial intelligence, data was classified and sorted in real time to identify key topics, trends, anomalies, and sentiment. Zen City reports displayed meaningful and actionable insights about residents' needs and priorities. This tool enabled the county to monitor public conversations to better understand what was important to residents. Without this tool, this work would be impossible to do among other important duties. Ottawa County was one of 25 West Michigan employers that participated in the Higher Reach program, a regional initiative which supports employers in piloting an evidence-based selection process. The process evaluates candidates holistically, targeting skills relevant to each job and reducing the potential for unconscious bias. Since launching the pilot program in 2019, the Ottawa County Talent Acquisition Team has hired 32 employees utilizing this method. In 2020, all 7 bargaining agreements expired. The county was successful in ratifying all 7 contracts. All groups except the juvenile court negotiated 3-year agreements, and they agreed to a 2-year contract. All hirings and trainings were moved to Zoom. The county was able to quickly secure a contract with Knowledge City for additional on-demand training courses. In 2020, during the pandemic, over 2,000 different trainings were taken, which ranged from on-demand classes such as accountability at work to multiple session courses like emerging leaders and Spanish. In addition, the county partnered with its employee assistance program provider, Pine Rest, to roll out online behavioral health courses, which were run on full online capacity during COVID-19. Robertson Brain Clinic's brain chemistry work, paid for by the Ottawa County Insurance Authority, was extended from the sheriff's office to public health, mental health, and eventually to juvenile staff as well. In 2020, there were over 300 employee leaves processed due to COVID-19 in relation to the Emergency Paid Sick Leave and Emergency Family and Medical Leave Expansion Act. In addition, payroll was successful in the payment of COVID-19 hazard pay for both the sheriff's office and public health in accordance with federal stimulus monies. 2020 was the Diversity, Equity, and Inclusion Office's first full year in operation. Over 50 organizations have collaborated to promote and support the ongoing work of the DEI office in Ottawa County, including the Community Foundation of the Holland Zealand area, the Grand Haven Area Community Foundation, the Michigan West Coast Chamber of Commerce, the North Ottawa Wellness Foundation, Lakeshore Ethnic Diversity Alliance, Gentex Corporation, Herman Miller Cares, and Hope College, and many more. The DEI office also convened local municipalities, townships, and villages to form learning communities of practices and will implement GARE, Government Alliance for Race and Equity, racial equity toolkits and equity plans. The DEI office partnered to secure 4 important grants, including the SAMHSA's Gain Center National Drug Court Institute Training Grant on Equity and Recovery Courts and Services, the Michigan Department of Health and Human Services grant to support the implementation of a migrant health survey, the Community Foundation of Holland and Zealand for racial equity work, and the Gateways for Growth research grant. Continuing efforts from 2019, the DEI office worked alongside Inclusive Performance Strategies to create and roll out a DEI strategic framework in Ottawa County. In March of 2020, the Ottawa County DEI work group was formed. The work group consisted of 15 county employees across different departments and levels of leadership to assist the DEI office in providing feedback during the document audit and to ensure participation in assessment activities and that it is diverse and well represented. This group played an integral role in the creation of a DEI inclusion strategy. In June of 2020, the DEI office hosted an the Ottawa County Employee Brown Bag panel with myself, Sheriff Steve Kempker, our CIC chair, community health worker Judy Kettering, HR manager Sarah Allen, Bob Vandepoel from Pine Rest, and DEI office director Robin Afric. 90 employees participated in the event. The panel was curated in response to the circumstances surrounding George Floyd and allowed employees to hear from leaders about their response and to ask questions regarding the aftermath of the tragic events. In the fall of 2020, the DEI office collaborated with the Cultural Intelligence Committee in the city of Holland to host the 5th Annual Diversity Forum virtually due to the pandemic. Feedback from the forum showed that 95% of participants learned something new. 88% increased their knowledge of DEI. 85% felt the forum increased their individual responsibility to create DEI upon the conclusion of the event. And 85% gained resources and tools that will help them in their DEI work. The county experienced perhaps the largest attendance for public comment in 2020, when approximately 430 residents from Ottawa County and many from Muskegon County appeared in a board meeting to speak their opinion regarding whether the Ottawa County Board should vote to continue to accept refugees per a presidential executive order that required counties to make this decision. About 2/3 of the group spoke in favor of continuing to allow refugee settlement in Ottawa County. With a year of hindsight, it is clear that none of the problems anticipated ever materialized, and that the refugee resettlement program occurred as it did for the previous 40 years. 2020 was a very difficult year for everyone. Ottawa County experienced Lake Michigan shoreline erosion, COVID-19, flooding in areas of the county that never experienced it before, and fallout from the death of George Floyd. Ottawa County services continued during the pandemic, and Ottawa County employees and the Ottawa County organization proved to be very resilient throughout. I'm just extremely proud of both. Hopefully you see the thread through this entire state of the county, where our employees, our departments are very resilient. They were able to respond and be creative and be innovative and do everything they could to both protect people and provide services throughout what was a very difficult year. As COVID-19 winds down, we are evaluating short and long-term impacts on how we operate and the federal funding status. Ottawa County also faced 3 lawsuits filed in federal district court, including one that was appealed to the U.S. Circuit Court of Appeals in Cincinnati over COVID-19 issues. The county was dismissed from one case and has prevailed at each stage that has had a judgment thus far in the other 2 cases. 2021 is already shaping up to be a better year. I look forward to continuing the great service provision and continuous improvement in everything we do, and in navigating whatever challenges come our way in 2021. Some of the top issues, there's many more, but staff kind of picked 10 of the issues to look for in 2021. One is creation of the formal groundwater board and some of the work that it will do. The G4G grant the DEI office received, so looking at the immigration population impacts on the economy, measuring those, such as they did in Kent County and Grand Rapids. Utilization of self-service kiosks at the clerk's office, so another extension beyond Francesca of artificial intelligence in the county and moving to more touchless services. That's one thing the pandemic taught us. If there's things we can do to deliver services in a touchless manner, then that'll be a big benefit in the future of where we're going, I think, in local government. Continued progress on the Justice Center, 2020 census results and Board of Commissioners redistricting, which I'll remind everyone is separate from the ballot issue that passed, which impacts state redistricting. The same method is in place. It's been around forever, I think, for county redistricting. Also, implementation of DEI strategies. I think as we move into how we use the innovation room for both our Toyota Kata and our innovation type work. Mental health becoming a certified community behavioral health clinic will be a big change, which should bring big benefits to those, some of our most fragile population who needs CMH services. The customer service recharge series. So we did round 1 of that recently, and that's intended, the Disney work was great. We get tremendous feedback, and our employees are doing amazing work out there. We see it as you recognize them each quarter for external and internal customer service, amazing work that they do. And then also the Southwest Ottawa landfill. I believe this will be a year where we actually have a definitive direction and start down that path. So these issues are all important. They're not in order. There's other important issues, but these are ones we think are important to watch over the next year. I'm honored to serve a county board of commissioners that is dedicated to providing high quality services, keeping the costs of government low, removing future problems before they occur, and also that supports innovation and doing things differently when it can be justified. Thank you.
Thank you, Al. And Kendra, I'm going to ask you to just hold on for a few minutes because I want to take a 5-minute break. Okay? I need to stretch my back. And I don't know about anybody else, but I'm taking a 5-minute break.
Did I wear you guys out?
Oh.
welcome back, everyone. I think we have Kendra up. Ottawa County Department of Health and Human Services, 2020 Annual Report.
Afternoon. Thank you. I know it's already been a long afternoon, so I'm going to try and make mine as short and sweet as I can. You guys do have a copy of my PowerPoint that I sent out. So I'll just kind of go through some of the highlights in those PowerPoints. So the first one obviously is the changes, and do I have control? No.
There is a clip there.
Okay, cool. All right, so just some of the changes and highlights that I wanted to go through. Again, I'm not going to read each one of them, but obviously COVID was a huge change and huge barrier that we had to overcome. And I do just want to take a moment to say thank you to Lisa and Doc from the Public Health Department, as there's many times that there was lots of questions that was thrown to us at the local DHHS, which actually was the DCH side, and just really appreciate their partnership and collaboration to answer many questions that came up from the community. So appreciate that. Other thank yous I wanted to talk about was first, when COVID hit for us in March last year, we ended up pushing up most of our staff, obviously, to be working mobile and working from home, and wanted to thank the county as we had to also close our lobby. And so our inner lobby was locked. However, our outer lobby that obviously the county owns allowed us to continue to provide service to clients without having a person there to man like a booth or a table with all of our information and things that we were able to provide to clients and or just the community. And so I wanted to say thank you for that. So that is kind of talks about a little bit in my highlights that we did move staff out. We continued to provide service, everything virtually. So all of our applications were done either on My Bridges and or paper applications slid underneath our door. We continued with Child Protective Services, continued those services as well, had a field team of staff for the first 3 months that were continuing to work with families and be out in the field. Our staff also were impacted by furlough days. So for 10 weeks, starting in May, we were furloughed 1 day a week, or the staff were, I was not, furloughed 1 day a week. So they continued to hold 40-hour a work week duties, but worked 32 hours. Again, excellent work from the staff. They did receive some of the COVID unemployment, so there was no loss of income for them. Our administrative support staff, I know it's already been talked about today, has been did help with the COVID hotline when that was initially put in place, and also with contact tracing at the state level. So we had staff that volunteered to participate during work hours to add that extra support that would not be part of their normal work duties. We also were part of the collaboration that the county established for the eviction diversion program, and I'll talk a little bit about that in the SER section. And we continue to work with individuals for eviction diversion to look at what we can do to assist with housing gaps that we have here in Ottawa County. That's other things. And the other things are some things that we did to keep morale and support for the community. All right, so moving on, assistance programs. So our first assistance program is our Family Independence Program, which most people would consider cash assistance. Just wanted to know, obviously, that there was a slight increase due to COVID from 2019 to 2020. And with our cash assistance, it does require individuals to go through our PATH program, which is established through Michigan Works. They also had to pivot and did not have in-person services, so everything was completed online. They did talk about the increase in individuals participating while having virtual orientations and involvement, so that is a positive. We are starting to see our numbers go back down just slightly as people are starting to go back to employment. Next, our food assistance program. The biggest highlights I wanted to share were actually the bottom 3 bullets of the FAP program. In 2020, starting in March, or actually April was our first one, individuals were able to receive the maximum benefit. So if they were normally receiving, let's say $10 a month for food assistance, the maximum is $16, they would then be bumped to $16 no matter what their income was at that point in time. So everyone was moved up to the maximum benefit. That has continued and will actually continue until at least June of this year. So we have had many individuals that have received more food assistance than they have in the past due to COVID. Also, individuals are now able to buy food online, which was not an option in the past. So due to COVID restrictions, people are able to purchase things on Amazon, Walmart.com in order to get their food delivered to them using their bridge card, which again was not an option in the past. And then thirdly, we now have something we've been trying to advertise with our Ottawa food related to the ability for individuals to start being able to purchase food at authorized restaurants using their bridge card if they are over the age of 60, disabled, or homeless. So we'll be working with our restaurants here locally to see if they are interested in participating in that program. We had that in the past and it was eliminated and it is back. So all three of those things are positive for our community in order to continue the benefits that are available to individuals in Ottawa County. And below you can see all the stats for the changes. Again, increases mostly due to COVID. CDC program, again, that's overseen by us, but it is also administered with the Michigan Department of Education. We did see a slight decline with our CDC numbers, which again would most likely be due to COVID and individuals losing employment, not having the need or necessity for our CDC. State disability assistance, not much change there over the last few years. Those are for individuals that are awaiting SSI determinations and have found to be eligible. And you can see the eligibility criteria on that slide. Next, our state emergency relief. This is the one that I just wanted to briefly mention about the collaboration that we have with the county is for our rental assistance relocation funds. As you can see, in my opinion, that number is very low, $15,895. We have started to do a deeper dive into our data based on issues of denial. And so starting in July, the end of July, we have been doing our own internal review as there are not reports that are provided to us related to why people are not eligible for supplemental emergency relief. And anecdotally, it's always been affordability for Ottawa County. And so we are continuing to do deep dives into that, especially with the eviction moratorium starting to be lifted, looking at, is that truly the reason and what can we do in Ottawa to assist with providing that data so individuals can see that that truly is a high need for us here and to get more money here in Ottawa. Individuals on Medicaid, again, numbers definitely were much higher than they were in previous years due to COVID. One of the biggest reasons, and we know that it's due to COVID, is because we can't close Medicaid due to it being until the public health emergency ends. So if someone applied for Medicaid and was eligible back in March, we were unable to close their case unless they came to us and said, I have another form of insurance. So all those people continued on Medicaid, even if their eligibility changed. So if they received other employment and now don't need Medicaid, it would stay on unless they contacted us. So that's definitely a change. Whereas otherwise we have what's called redeterminations to review their status to ensure their eligibility. So until the public health emergency ends, that will continue. So that's the same also with the Healthy Michigan Plan as well. So again, seeing very large numbers. All right, outreach. We did continue with outreach in Ottawa. Again, I have fantastic staff. First, our migrant and seasonal farm workers. During the pandemic, the very beginning, they were still out assisting with the farm workers. They also were part of the COVID testing that was required by the state to be conducted with all of the farm workers. And so they were out assisting with that. Obviously with PPE supplies, they were getting those out to the farmers as well. And then many of them stayed longer. And so we also did some coat drives and other things to keep the farm workers here and working. So great collaboration with some community partners on that. Pathways to Potential. This is the individuals that we have out at the schools. Again, very thankful for the staff that I had. They were interested in going back to the schools right away. That was not required, and many other counties chose not to send their staff back into the schools due to COVID concerns. However, here in Ottawa, the staff asked to go back because they felt like they would be much more productive to the families, trying to help them with that transition and any kind of needs that they had. So our staff went back right away in August. So very proud of them. There is one change. The Jefferson, as you can see, was Allegan County that they chose not to go back and actually just ended their service at Jefferson at the end of February. So we have lost that site. Employer Resource Network, we did have some changes here as well. We previously had a site at Herman Miller, or a worker that was specifically there. However, that site also ended at the end of September. And so as of October 1st, we are not providing services to Herman Miller. Our Lakeshore Employer Resource Network has all of those employers listed. That also had some changes, and you can see at the bottom. We added 3 more businesses that are participating, and we lost 3. So Trendway, ODL, and Global Technologies do not have our services any longer. Flexible spending accounts and contracts. You can see those dollar amounts. Those are for a variety of different services, direct support services and emergency services, and on our AP side or our assistance side. And then counseling, FTBS, DFA, and parenting time are all on our child welfare side. Again, money filtered into our office to go out to families. Beds for kids. This one, as I was actually reviewing it, brought me back because it ended actually last March. And our last pickup was the day before COVID was officially here. And we picked up some beds from Kalamazoo and brought them to Ottawa. We did continue to provide this service in other ways. Our community resource coordinator does an excellent job of collaborating in the community and was part of all of the collaborations that were occurring on the Mondays to discuss needs for families for COVID. And she was able to get a grant from the Holland Zealand Community Foundation because they saw that there was that continued need for beds for families. And so during this last year, she received $3,000 to continue that service, even without MDOC's partnership. And so we did provide 31 beds to kids in our community. All right. And then, as I mentioned, obviously our child welfare services continued through the pandemic. I did want to note that there is actually a change in this slide. The data at the bottom, let's see, of that number, 1,373 or 41% were assigned for investigation, which is correct. So much lower, as you can see, from 2019, a very significant drop in the number of investigations that were assigned. I did want to note that currently, the department is going through what's called front-end redesign, which is reviewing CPS from the very beginning. So when a centralized intake call comes in, they're doing a little bit more analysis on the need to assign the investigation. So in 2019, they assigned 52% of the cases that came into to centralized intake, whereas last year it was 41%. So a pretty significant difference. And then the number of calls that came in was a decrease by 16%. We are doing some deeper dives into that. Most of the question is related to schools being closed, obviously from March through June, and the number of calls that come in from mandated reporters. So as soon as that data becomes available to the public, we'll be able to provide that with more specific information. But what I wanted to share was that 668 or 48% of the investigations were substantiated. And of those substantiated, actually the number should not be 206. The 206 is actually the number of individuals that were placed on, or cases that were placed on central registry. But the number of actual cases that were petitioned to our local court was 50. So 206 should actually be 50 if we're looking at local court petitions. And so that number would be 7%. And in the year previous, it was 12%. So we did see a decrease in the number of cases in which we petitioned to our local court to be involved either for in-home services, for compliance, and or removal of children from the home. Other thing to note is that 50 cases doesn't necessarily mean 50 children. So that would be 50 families. And of course, families can have, a wide range of kids, 1 to 8. We have had some rules of 8. And so it's more than 50 children. And then lastly, so with that same thing on that same sentence, of the 3,378 assigned cases, it was 1.5% were petitioned to the court. So again, a much smaller percentage than 6. So I want to make sure that that was pointed out. During COVID, we did some pretty intensive assistance with our CPS cases. So because our numbers were lower, that did allow for more time to do prevention. So we did have CPS workers that were doing what's called a CPS outreach project, which was contacting clients that may have had a category 4, which is a case that was denied for CPS, and or a category 3, which meant there might have been some concerns, but didn't rise to the level of a preponderance. Those individuals were contacted to see what were their needs, how could we help them? If it was a domestic violence or a spat they may have had that didn't lead to the children being involved, but maybe now that they're home 100% of the time, locked up together for 6 to 8 weeks. How are they doing? What can we do? So much more prevention services. And we saw some things like clothing and walking through food, how you apply online and things like that. So definitely some good things to see. And we're hoping to continue some preventative efforts here in Ottawa County as well. All right, next is foster care. Our numbers did go up slightly for our average of kids in care. However, we did do a ramp up during COVID, what was called rapid reunification, which started in April. So April through July, we did some very deep dives into cases to see what could we do to get children home that did not have significant concerns. So if they were doing unsupervised visits, we obviously had the restrictions of not being out in a car, not being places. And so really eliminating some of those barriers to see if we can get kids home successfully. Did a lot of virtual oversight of kids being returned home, which we found to be valuable as well. So we are starting to see some of those numbers hopefully head back down. Foster home licensing, we continued to license homes and actually did better in 2020 than 2019, just slightly. We went up 4 more than we did the year previous. Staff just did an amazing job, virtual home visits and such, but definitely more people, I think, maybe when they're home for the time, maybe rethought like, hey, how could I help people in the community? And so they wanted to be licensed. So that was great. So we're hoping that that continues. We also started 2 contracts called transitional placement program, which is like shelter care. So for those of you that have been around for a while, we had that many years ago and then we got sued and they said, take it away. But they have found value in it coming back with a little bit more restrictions. So we are blessed to have 2 families that are willing to be shelter homes so that we can assist with hopefully not having as many kids end up in residential. So good work there. All right, our Michigan Youth Opportunity Initiative. This also had some changes due to COVID. This is a program that allows individuals that have aged out of foster care to continue to receive assistance, both financially and through case management. During COVID, through July and August, they allowed for individuals to be part of the program even if they didn't normally qualify. So in the past, you had to be employed and or attending educational services, and they took off that requirement for COVID in order to get more individuals involved. So we did have a few more participators than we would have in the past in order to allow for that exception. All right, that is all I have. Questions?
Questions for Kendra?
Yeah, I have a couple of questions.
All right.
Kendra, I wonder if you can explain the difference between the employer resource network versus what the Michigan Works does.
Yeah, so Employer Resource Network, we've actually been in businesses for over 10 years. 2010 is when we started. And what we do is we provide direct assistance to employers for their employees related to anything with the department and or if they have hiring things they'd like our staff to be involved with. But the majority of it is to look at barriers. So they're looking at child daycare. They look at things such as our DSS, our direct support services. How can we keep their vehicles running if they've got like back rent? The other thing, the other biggest benefit is we have what's called AAC loans. And so if someone is participating with our staff, they can apply for an AAC loan, which allows them to get a barrier-free loan that they end up saving money while they're paying off whatever it is. So I'll give you an example. We had someone that had medical expenses they were paying for their parent who lived with them. And so I believe it was like $1,000. Well, they didn't have that and they didn't want to have to go do a Quicken loan kind of thing, you know? So this way they were able to get the loan with 0% interest. Instead of paying, I think it was like $100 to pay off, they were paying $120. Well, that $20 then went into a savings account for them. And after they paid off that loan, they then had that additional $200, I think it was $200 for their next issue or the next concern they had. So it was really trying to bridge those gaps for individuals that go paycheck to paycheck.
Okay, thank you. And then Red, a quick question. What percentage of the calls that go into Child Protective Service come from schools? And I ask because obviously school's been out, you're not getting as many calls from schools.
Right. And I can get you the specific data specifically to administrators and teachers if you would like.
Okay, thank you.
Yeah.
So that would explain why the number of cases are down considerably. Would you agree?
That is what we are lending to. Yes, they're trying to finalize some data to compare one time to the other. The other thing too that's very hard for us is that Ottawa County was actually one of the very few counties that had a majority of their schools open, to full-time education. And so even looking at our surrounding counties like Allegan, for example, where my kids go, they were not open full-time. And so they're really having a hard time trying to pull out the data specific to counties to say, well, this county has been open, this county has not. So we're trying to drill down some data to specific locations to say which ones were open and did that impact. So the ones that were open, did they start seeing the increase again because there was mandated reporters calling? I think the other thing too is just kids were not out. Everyone was home. And so you're talking about a period of 6 to 8 weeks, 6 to 12 weeks where you weren't even seeing kids. And so even your neighbor's not calling because they're not seeing the kids,
But you would
So those
think
things-
with the increase in domestic violence that you would see a increase in child abuse as well, but apparently you didn't, or it wasn't reported.
I would say probably a little bit of both.
Yeah. Okay. All right. Anyone else?
Roger, on that, as long as there's health emergency on that Medicare, who makes that law that they can't be reported during that time? Is that a legislative law, or how is that law created that if they go back to work, they still get that money?
I'm not 100%.
That one slide you had, you showed about, you said one little thing in there that they can't report back to you. You can ask them, even though they went back to work, they still got the benefit. So why is that a state law, or where does that come from?
That's a great question. We get it through a policy memo. So our policy office will say, sorry, we cannot close Medicaid cases until the public health emergency.
Don't know who makes that policy? Does it come from the legislators from Lansing, or don't you know?
I will ask that question.
I think that's a good thing for us to know, because if people are going back to work, there's no reason that we should spend that money on them, as far as I'm concerned, so.
Anyone else? If not, thank you, Kendra.
Thank you so much.
And the next thing on our agenda is Ottawa County Innovation and Technology. Paul. You get to limp over to the.
Getting better.
Okay, good.
I'm gonna look like that in a couple of minutes.
I can adapt. I think we're just gonna skip the PowerPoint. We don't need to. Yeah. County administrator's already touched on how the county's leveraging technology.
You mean he took your thunder?
Yeah, I could just say ditto as was referenced out in the hall. But I know if I get too techie, I have a tendency to put people to sleep. So let me just hit a few highlights. Yes, we have refreshed our entire data telecommunications network. And we have broadened the use of Wi-Fi, both in this facility and at the jail, and will soon be out through all the rest of the facilities. We now have security information and event management, network access control. We have a certified security officer. We have advanced malware protection all in play. Now, what does that tell you? Our security profile is looking pretty good. It needs to be tuned some more, but I'm feeling pretty good about it at this point. COVID, when 50% of the users all walked out the door and still expected to work, created a lot of challenges, both from a security perspective, access, bandwidth, everything. Support had to change. You'll find your IT people were very much able to adapt and overcome those things. In addition to collaboration tools and things like Zoom and Teams and so forth, the GIS group put together a dashboard for public health that has been seen well over 1 million hits. And I think it's gone through 3 or 4 versions. So it's constantly evolving. I'd venture to say it's been more like 1.5 million accesses. Yes, Office 365 has been deployed to 93% of the users. And that includes things like Teams and SharePoint. But this is a framework, not a prescriptive process. So business units are figuring out what they can do with it, how they could leverage it to meet their priorities. And they're being really, really creative. Things I never anticipated. We started with Parks. Parks is probably the furthest along in this regard. And they're doing some amazing things. And I'll let them share all those things with you. But basically what that means is we have a foundation in this Microsoft world now that will serve us for the foreseeable future. There's 1.2 billion users of Office and 300 million plus users of Office 365 online. We're in good company. Yeah, this is feeding my mission to be sustainable and strategic. Very much so. Got us aligned with a whole Microsoft enterprise agreement, which we will be growing into. Let me hit a few things of what else. We are using digital signature processes now, not just for contracting. I'm really curious to see how the warrant process changes with digital signatures. Pretty cool. Definitely going to be a game changer for a lot of the business practices throughout the county. We're deploying business intelligence technologies now and have access to the entire suite of Microsoft's artificial intelligence capabilities. How we're going to leverage that, I don't know quite yet, but if the Office 365 deployment is any reflection of how this organization engages and leverages things, gosh, it's going to be exciting. It's a lot of change. It's got the IT world, my world, terribly geeked. Everybody's learning something new in my team. They're excited because of it. In a lot of cases, it's just going to be maturing in the organization going forward. But I can't even give it a timeline of how fast that'll happen or how long that will take. We have a single sign-on, remote processing, and we're even touching on some more advanced capabilities like integration processes as a service. Part of our strategy is to get to multi-cloud. Everything was on-prem. It's not anymore. It's in a Microsoft Azure cloud. It's in the Office 365 cloud. It's in multiple clouds. And how do you communicate all that and make those systems work together? It's a challenge, but it's a challenge that we were already invested in, and are learning to do. So what about the future? The future looks pretty bright. We're operationally sustainable and will remain that way. Just like I mentioned, the network refresh, that'll happen every 7 years. It's something that's just going to be a part of our budgeting process, a part of our strategy processes, and it'll change from time to time, from refresh to refresh. But we're not in a position where things are going to falter. Things break, like the device here at your last meeting, but we hope not the things that are operationally critical to maintain communication, to maintain data and telephone and our server frameworks. And as I mentioned before, we have a robust security profile that's just only going to get better with time. The investment has been made. It's really a matter of learning and tuning from this point forward. We're on the right path in every other area with proven commercial off-the-shelf tools. You'll hear about this going forward with jail management. You'll hear about it with court management systems. The organization is not customizing things anymore. That tells us that we don't have to worry about how we're going to sustain an antiquated framework like the Office 365 world. It changes every week. They don't tell you, they just change it and you benefit from it. But there's a lot of people behind the scenes making that all work, and not just one or two technical engineers on premise trying to keep everything held together. And as I mentioned, we're looking for a balanced on-premise and cloud strategy. That's going to evolve over time as well, but it's already at that point of being engaged. We got a couple of other things up our sleeves. Conditional two-factor, multi-factor authentication, things that might bore you, but you're gonna end up using some of them. So for example, if you're not on our network and you're accessing our accounting system, you'll have to go through a two-factor authentication, not just a password. Everything that happens in the sheriff's world has to go through, by mandate, a two-factor authentication, a multi-factor authentication. We own it already. We're learning how to do it now. Give it a couple weeks and we're going to start to see what all that looks like and feels like. So if you want to dive in deep, I'm happy to do so, but that's a quick general highlight.
Mr. Chairman,
Yes.
I have a question. Paul, explain a little bit. Maybe I didn't catch it all and everything. The login business, you got a password, but you said something else.
It's called multi-factor authentication. So you might already be doing it if you do online banking.
Yep.
Well, you'll get a text that says, now you need to put in these 4 character or these 4 numbers to say, yep, that's you.
Okay.
It's not you gave your password to somebody else or somebody else gained access to your password.
Okay. Okay. If I go on my bank on 2 different, like a laptop and my phone, then they'll all of a sudden say, is this really you? And then I get a text and I got to text it from them. Okay. Okay. That makes sense. Okay. Thank you.
Anyone else?
Mr. Chair.
Yep.
Like how the sheriff's department is struggling a little bit getting qualified staff, deputies and good employees. Are you finding it difficult to keep people with the organization, Ottawa County, and good qualified staff? Is that something that you've been experiencing issues with at all or not?
The risks facing IT in general haven't changed, and you can read that in the report. The pace of change is just crushing all the time. Talent management is what you're referring to. How do we maintain talent? So before, the common practice in IT was you go hire it, or you groom it, you build it. And that's not sustainable. Now, today, we have experts that we can reach out, phone to, that are already under contract for just about anything we need. If I need a very high-end network engineer, which would be a certification of a CCIE, Cisco certified network engineer, I can get one. I don't need one on staff. I just need one when I need one. That's the way we're handling our chief security officer too. He's really with Trace3, a national firm, but he's very much in tune with where we're at, where we're going, and what our priorities are, so that he can guide us, to the next step. And we meet with him quarterly. So no, I'm really comfortable. That the team that we have, very excited about their careers and their experience building. But I don't anticipate any sort of competitive problem or replacement access problem.
Very good.
Anyone else? Yes.
Paul, is there a security risk having so many folks that we can contract out for assistance like that? Or is there some kind of a security process that we put in place when we contract them?
Well, everything in the IT world in my budget has been openly procured, openly through an RFP process. So we put out an RFP for that chief security officer, got, 8, 9 responses, evaluated the responses, and specifically the individual that they would post towards us. So yeah, I mean, it's really their responsibility. And here's another advantage in that. It's not just the Ottawa County experience. It's not just knowing what our system is. These individuals that we have as an extension to our team are working for other states, other cities, other counties, all over the place. And they bring unique perspectives of what everybody else is doing and how everybody else has overcome certain challenges, like security challenges. So when we started going down, we got him first, and then we went, okay, what do we need? We need a SIM, we need an AC, we need an AMP, we need all these things. And then we procured those as well. No, I'm pretty confident in this situation. It's never going to be perfect, especially from a security standpoint. You read about it in the news all the time. And there's some really creative people out there, but we're much better than we were last year, and we're going to be much better next year.
Anyone else? Thank you, Paul. Jennifer, you have been patiently waiting this whole time. Why don't we have a full screenshot of Jennifer so we can listen to her? There we go.
Thank you. And I'm going to go ahead and share my screen. Okay, and hopefully everybody could see that.
That's good.
Okay, perfect. So my name is Jen Brzezowski, and I'm the program director here at Ottawa County Community Action Agency. Starting with our mission, OCCAA exists to reduce the effects of poverty in Ottawa County by promoting self-sufficiency and economic independence. The following causes are different reasons why we might see somebody in our office. Just some examples being high housing costs, those that might have fluctuating work hours due to unsteady pay. And then lastly, the most important one that we've seen a lot this year, of course, is COVID-related needs. So in addition to our regular grants, we had quite a few COVID-related funding this year. We had our CARES funding, which we've used a majority of that funding for additional utility assistance. We also had our emergency services program that helps with different transportation services, including car payment, car insurance payment, and car repair. We also had a migrant farm worker program that provided a $1,000 stipend to those that were in quarantine or isolation due to COVID. We had a water and plumbing repair program that helped, that helps with any water issues that might influence hot water or the ability to clean and sanitize in the home. Our quarantine kit program, which provided hygiene supplies, food, and other items to those that were in quarantine or isolation. And lastly, there were additional MISHDA grants that we oversaw as we're the fiduciary, and those we worked with a number of sub-grantees such as Good Samaritan Ministries for those. Just thought it would be helpful to take a look at the differences between our 2020 Walk for Warmth, our annual fundraiser, and this year's. So last year, our total donations were over $17,000, and we had approximately 230 walkers. This year, of course, looked very different. We moved the walk to a virtual walk just to mitigate COVID and be safe. We had a number of smaller groups that participated, and we were able to receive over $7,000 in donations. Those continue to rise, thankfully, and we're seeing other groups start to form now that the weather's a little bit nicer. We're hoping to see that dollar amount rise. This chart is showing a breakdown of the different services that we provide. The largest one being our food assistance program, the largest number of individuals served is with our food assistance program. Second being our tax assistance program. That number is going to look different next year. We did not go forward with our tax assistance program due to COVID. Our tax preparers were not comfortable with having those interactions this year. And then third is our utility assistance program. We were able to serve almost 200 households with that program. Our annual budget, you're going to see a large increase in that as well. So for 2020, 2021, our budget is over 4.1 million. The reason for that is the large number of MSHDA grants, housing grants that we are the fiduciary for. So that's why we've seen such an increase, as well as all of our COVID related funding that I mentioned previously. Just to break that down by percentage, again, 60% of our budget right now is in COVID grants. Again, with that large percentage being with the fiduciary and our housing grants. Next up being our weatherization. That program is extending to 2 years, which is typically a 1-year program. We're trying to up our numbers for that program because it's something where we go into the home. We saw a major decrease in that around last spring. So they've extended that program so we could utilize those dollars with the year moving forward. And then our CSBG is typically our largest funding source for our programs. And then our food commodity programs, that number fluctuates. We see an increase in that a little bit later in the year. Next up being home rehab, and then our utility assistance programs and Walk for Warmth. That number being much lower, again, partially due to COVID. And then we also used to have a match from Consumers Energy that has since ended. Just to kind of give you an idea of what the breakdown is for income. So most of our programs, we serve up to 200% of the federal poverty guideline, and that number is 25,520 for a person of a family of 1. Just some demographics, you can kind of see those that we served in the last program year. We have 60% of those being renters. The majority family type, we see a lot of single adults. Education-wise, we see a lot of those that have a high school diploma, GED, or maybe less than high school. And then in the health department, we see about 50% of individuals have some kind of health insurance. Other demographics, our largest age bracket is that 18 to 54 range. Next up being individuals that are 65 plus. That's mainly because of our food programs. We serve a lot of seniors in our programs. Work status, we also see the largest amount being either retired or unemployed. And as far as income goes, the amount that we see the most of are those that are between 51% and 100% of that federal poverty level that I mentioned previously. So I feel like the data is, of course, very important, but these stories really help paint a picture of the things that we do every day. So this first story being about a family that did not have any running water. And thankfully, our COVID relief funds helped them get a new well, and they were able to get running water once again. Next up is a gentleman who had significant health issues, and he did not have access to a safe running vehicle. So our COVID relief funds helped him to get his car repaired, and then he was able to get to his necessary medical appointments. So a little bit more about our weatherization program. This again is one of our main programs. whether it be with or without COVID or during the pandemic. So these photos show the before of one of our weatherization projects. As you can see from the photos, there were some air leaks and some lack of protection from outdoor elements, which caused the family high heating and cooling costs. And in the after, you can see some foam sealer, some spray foam that they use for insulation, as well as and a windowsill was installed so that it could prevent cold air leaving the house. And also it helped reduce some of those energy costs that the family had. So looking forward for 2021 and beyond, continued training for myself. So I started here in June, so I continue to train and learn more about the programs. Also, we'd like to continue our high performance on our state monitoring and our organizational standards. We have a great reputation with the state, which we plan to maintain that as well. We have quality management of our funding streams. Even with the uptake in the program funding, we were able to maintain the same staff. And the staff here have a lot of longevity, which is great. We'd like to continue our successful partnerships with other community agencies. As I mentioned before, we have great partnerships with a lot of our housing agencies in the area. Our state risk assessments, we always have a great score for that with the state, and we want to continue that. And then lastly, just continuing to navigate the complex grant requirements that we have for our multiple programs, and just continue that, that upward success for the programs. Okay. Any questions
for Jennifer? Anyone? Doesn't look like it, Jennifer. Thank you. Thank you for patiently waiting too.
No problem.
Yep, thanks. Okay, the next thing on our agenda is general information, comments, or meetings attended. Anyone? If not, I'll entertain a motion to adjourn. Oh no, public comment first. Is there anyone in the public?
Currently, no.
No? Okay, then I'll entertain a motion to adjourn.
So moved. Support.
Moved and supported. Comments or questions? All in favor, say aye.
Aye.
Opposed, same sign. Thank you. Okay, moving right along. Next page.
No kidding.
You guys ready?
Born ready.
Laptop wasn't my turn here.
All right, I'll call to order this meeting, this work session. The date is Tuesday, March 9. I think we need a roll call. Justin?
Sure. Mr. Garcia.
Still here.
Mr. Bauman.
Still here.
Mr. Zylstra.
Here.
Mr. Dannenberg.
Still here.
Mr. Meppelink.
I am here buckling my seatbelt.
Oh, okay. He's here. Mr. Terpstra.
I'm here.
Mr. Hovluer.
Jim's there. I see
He's
him.
there. I see him.
Mr. Holtluer, yeah.
Talk to us, Jim.
Yeah. Well, he just jumped in the ocean.
I'm here.
Mr. DeYoung.
I'm sleeping. I'm here. Sorry.
Mr.
Happy hour.
Mr. Kyers.
Here.
Mr. Bergman.
Here.
And Mr. Fensky.
Here.
Mr. Chair, we have a quorum.
Thank you. Public comment? Communication from staff? Anyone?
We do have a public comment on Zoom.
Okay, we do have, okay. Go ahead, you want to explain it? a minute?
Sure, yep. If
go
I can
ahead.
just ask that you state your name and your address for the record, please. I think we've got.
Am I unmuted?
Yes.
This is Becky Mulder. My address is 1587 Rebecca Run, Hudsonville. And I just wanted to piggyback on the two ladies who spoke earlier after Lisa spoke. They basically said all my sentiments, but I wanted to also emphasize that I'm sure the health department will come back in reference to the contact tracing, that the issue is the kids bringing it home to their adult parents or grandparents or whoever, whatever other adults are in the home. But if you remember, a few weeks ago, Governor Whitmer had a pediatrician from the south side of the state who said these kids, high school and elementary, are not super spreaders and they're not taking it back home either, even if they're asymptomatic. I would just beg you to relook at this and revisit this. The contact tracing, we have no cases where these kids are getting COVID. It's their mental health that we need to be concerned about. I'm just requesting that you please revisit. If not, please show us the science and data that shows that these kids are a risk to their parents or other adults in the home.
Thank you, Becky. Anyone else?
No, sir.
Okay, all right. Okay, work session item, digital inclusion strategy. I'll bet you that's why Paul's been here all this time.
Yes. Good afternoon, Mr. Chair, Commissioners. Thank you for your time. You have full plate today, so I appreciate it. I'll try and make this presentation as exciting as it can possibly be. So I'm going to offer some background history on what the county has done over the years to address connectivity to the internet for our residents and businesses, as well as the challenges that we've faced in doing so, and then where we're at today and where we are going in an attempt to provide and address the inequitable access to reliable, affordable internet for all residents across the county. So for many of you, you may recall the Link Michigan initiative that Governor Granholm initiated, and this was back in 2003. So Link Michigan was an effort that Granholm created, and it was designed to, this is a quote from Link Michigan, designed to transform Michigan's infrastructure to be one of the most robust in the nation. So that program did a study for Ottawa County, and these are quotes from that study. It says, over half the users in the county see no value in obtaining high-speed internet. It also said that many of the gaps in access to the internet are perceived. They're not real. So ultimately, the conclusion of that study was at this time, the existing high-speed connectivity infrastructure in Ottawa County is not a limiting factor in reaching the goals. So that really started us off on a poor foot because there was that misunderstanding. The infrastructure exists. If people wanted to access the internet, they could do it. But building a robust infrastructure has always been important to the county, especially with emerging technologies. Then as wireless started to expand and become something valuable for the future, and 3G rolled out about 2005, we looked at opportunities to facilitate expansion of 3G. You know, there were challenges not only with residents with cell phones, but our patrol officers, dispatch, were having issues in the more rural areas of the county with wireless capabilities. So we partnered with a startup company out of Grand Rapids called Broad Breeze, and we did some testing for mobile high speed. It was really unique at the time to have mobile internet connectivity. And we set up a partnership with that company to do some demos with their EVDO technology, which is a version of 3G. And we worked in Jamestown Township and the city of Hudsonville and did some pilots. It seemed to work well, but the company itself just didn't have the capabilities to start to expand this out, especially when the other larger companies started to make some moves in the wireless space. So there were some build outs in the county of wireless, but it was cherry picked, if you will, by where carriers want to put up service. It goes to where there's most dense population and they get their return on investment. So that was our coverage back in 2007 as a Sprint example. The green indicates coverage exists, white are dead zones. We knew we wanted to address those dead zones, so we did an assessment of public infrastructure that could be available and some private landowners that came forward and said, you could put a tower on our property. So we said, okay, let's leverage public assets. And we can partner with the private sector to reduce the cost, their ROI, and be of value for us. So one example that came out of that, Sprint was the first company that we had to partner with Grand Haven Township. They were the first carrier to go on the water tower, and that's along Lincoln Street, which was a great learning opportunity for us and how we could make this work for the bottom line partnership. Then Sprint also, we said, if we start to promote what you're offering to our residents in the county with your service, public-private partnership, a memorandum of understanding, offer our residents some additional discounts, and we'll essentially promote your service to local units and residents. So Sprint came in and offered discounts to our residents, 20% off of some of their equipment. And in exchange for us in this agreement, they invested over $1 million expanding their network across Ottawa County. And that also not only involved them installing new equipment on existing towers, the Board of Commissioners, you may recall that we built a few towers. And that was part of that agreement to help the bottom line for providers to expand access. So we built a tower at Fillmore Street just to the west here, and Sprint and Verizon went on that tower. We built another tower on Johnson Street in Robinson Township, and Verizon and AT&T went on that tower. We started to develop a good relationship with Verizon. They saw what we were doing, and they built a few more towers. I worked with Howard Bauman and Port Sheldon Township, gave him examples of our lease agreements and how we went through that process, and they had some co-locations happen as well. Ultimately, over a couple-year period, we filled our gaps pretty well. But there's still challenges. Wireless is not a long-term solution, especially with advancing technologies and data issues. And there will still be dead zones. There's still topographical challenges, with some of our hilly areas and ravines along the Grand River. There are data caps. Those things are starting to be addressed, but there are still data caps on wireless transfers and usage, and cost remains prohibitive for many people to get the services they need. And we also know that there are alternatives to connectivity. Satellites. People can get satellites. I've never heard anyone, at least to me, say we love our satellite. It's always reliable. It's always there for us. And the speeds are there. I've not heard that. There are also other individuals that have said we're tired of waiting for the right service to come to our community from a fiber, for example. So they build their own towers. And they do line of sight service. You build your tower tall enough at your house, you can do a direct connect with some local providers. That is not cheap, right? So not everyone can do that either. It's an affordability issue. Then there are new opportunities that are starting to emerge called the space race for broadband, if you will, where Elon Musk, for example, with Tesla is looking at low Earth orbit satellites, LEO networks. It's starting to get some good buzz, and people are saying this is going to revolutionize connectivity for rural areas. It is years out. And I'm hearing this from technical consultants that support us. I mean, we need to assess all opportunities that are coming before us on new technologies. This is very early. It's expensive. The equipment is costly. It may not, again, be a solution for everyone. It may help some people. And it's also still years in the making to be reliable. But we should keep our our pulse on what's happening in that area. So then we've probably all heard of the Connect Michigan program that is supported by the state, and they released some maps in 2016. If you look at Michigan and Ottawa County, boy, we stand out as having countywide, we're the best in West Michigan. We've got, everyone has up to 25 megabytes for service. We know those maps are woefully wrong. And we hear complaints. I'm sure each of you get complaints. Our office receives complaints by residents saying, I have no internet. I still don't have access. We have no cable. Whatever you can do will be greatly appreciated. Need more reliable service, and even one individual's recognized, he goes, it's crazy. I have service at my house, but my neighbors don't, just down the way, and they can't get it. And the maps are a driving factor for the challenges that we're facing, because the providers are looking at the maps and the granting agencies are looking at the maps saying, well, they look pretty good, so maybe they're not eligible for you. But it's the FCC that's really driving this, because it's how the internet service providers report where their services are located. And you may have heard it's done by census block. And ISPs report on a 477 FCC form where they offer their service. So census blocks, to refamiliarize you with them, are defined basically by physical boundaries like roads and jurisdictional boundaries as well. So in more urbanized areas, clearly we have more roads. So our census blocks are smaller. So I'm just kind of highlighting those there in yellow. But when we get out to rural areas, our census blocks are much bigger. But the same reporting technique still happens by providers, where if they provide service to one house in a census block, they map the whole thing to say it's covered. Anyone can get the service, or service is available, and that just is not true. This is a very, very big issue that's at the federal level as well. But it's impacting how we can address our challenges moving forward. So then Connect Michigan stepped forward and said, okay, this is a program supported by the state, said through thorough mapping, we'll work with our communities to become more digitally inclusive. And it's supported by MEDC, Public Service Commission, Department of Management and Budget. We said, okay, I think at the time that we signed on, you may remember, we said, okay, we'll do this Connect Michigan program. We were the last county in the 13 county region to do it, because we were doing a lot already in this space, and said, okay, well, let's do it. I'm not sure what we'll get out of this. But if anything, for me, it was bringing to light the issues and also bringing stakeholders around the table. So we said, okay, let's partner. We said, we'll do this. We'll get together with Connect Michigan. We established a large steering committee of very interested individuals that all knew that this is something we had to do. And Connect Michigan distributed surveys that actually only hit 2% of our households in the county. Like, we have 105,000+ households, and they hit 2,000 of those. And they got some feedback report for us in 2008. And they certified Ottawa County as a connected community, and they said, you should do a press release and say you are now a certified community, connected community. And we said, absolutely not, because we know it's not true. And just look at the maps. So this is a map from that report. And it says in Ottawa County, 25 megabyte download speeds, 98.1% of your residents have access to this. Less than 2%. So we got, of our 105,000 households, we got like 1,800. That's it, that aren't connected. And then they said 100 megabyte service, 97.8% of all of your residents can access this speed. And then there's a disclaimer in the report that says, well, it's done by FCC 477 maps, and they may not be entirely correct. So great. So on our webpage, because we want to continue to get that feedback to support our drive and initiative to address this, and we get people filling this out all the time. How's your speed at your house? Any assistance you can give us. You know, my neighbors, if we sign a petition, can we do something? You know, it just seems like something has to be done. We're struggling. How can you do it? I mean, we get this feedback nonstop. NACO has recognized this as well. There's a need for accurate broadband mapping. I think you're each aware that they formed a task force. So Jim Story and I sit on that task force, and we'll see where that goes. This is a large, complex endeavor to try and address, and they've created some subcommittees. And Jim and I have been talking. We split up on subcommittees, and we'll see where that goes. I think anything, the biggest advantages that I've talked about is at least the advocacy. Once we can find out what's happening at the state and federal levels that are barriers, it's organizations like NACO that we can continue to talk with our legislators and others about what the issues are that we're facing. Governor Snyder, he also did this broadband roadmap that you remember, and there was a participating organizations. Well, we sat at the table on that one as well. And one of the short-term actions that was identified in that plan also from Snyder was, we got to fix the maps. Okay, great. I think we should fix the maps. But we knew that was going to take time to do it, and we didn't want to wait. But simultaneously, the grant programs became available to support expansion. And these are grants that were only available to ISPs. Not available to local units of government, not available to municipal Board of Public Works and others. It was only for private sector providers. So we had to find a provider to partner with. So I brought all the township supervisors in. I think I had 7 of them at the time sitting around the table. Every one of them has issues in their jurisdictions. And we said, okay, well, let's try this out on a pilot basis. And Talmadge Township had the most vocal residents at the time. There was a large collection of residents in Talmadge that said,
Fired them up, that's why.
yes,
Yeah.
it was great. And that was really helpful because we did a pilot of better surveying and community meetings. So we partnered with a smaller, nimble provider, Don Nordyke and his son. They have a company called West Michigan Broadband. And they said, okay, let's talk to these residents. Let's figure it out. And if there's enough interest for them, and he can get a grant to expand service, he was going to do it. Absolutely. I said, okay, well, let's drill down and let's survey even more. So you remember Connect Michigan, they surveyed just over 2,000 residents countywide or households. We sent out nearly 3,000 surveys to the entirety of Talmadge Township. So we partnered with Talmadge, split the cost of this survey, had a great response rate of 40%. And the results came back that I can't see that far. I think it was 41% said cost is an issue, and it's maybe another 37% said we just don't have service. So looking at the data further, there was the strongest concentration of frustrated people on Luce Street. And here is a street that, surprise, 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 but here is a street that's less than a mile away, right? For the most part, from the second largest city in the state of Michigan, and these residents can't get anything. So Don Nordyke and our department in Talmadge, we said, okay, let's apply for this grant. We've refined the data. We're going to make this happen. We applied for the Connect Michigan grant program. And there's Luce Street. You see that gray area right there in that box and that little dot? Well, years ago, in that spot right there, years ago, AT&T got Connect America funds. They got a lot of dollars, and they define that as an area where, well, that's our service territory. That's where our grant dollars are going to go. But they only connected one household, and our understanding is that they're looking at saying, well, we're good. That's all we have to report. So it goes back to their service areas again. And so we were not able, so we weren't able to do it. Don didn't get the grant because he didn't have enough density, right, to go anywhere else. So our pilot it was a real struggle. It really failed. Jennifer Owens shared this article with me not too long ago. She goes, boy, this is really relevant, right? And the author of the article had his own experiences and said, the only problem is AT&T doesn't actually serve my address, right? That could be the obvious answer, but they say they do, but they really don't. And then the FCC and the providers themselves are apparently pretending there's competition. A number of places where there really isn't competition. This is a real big problem. So then those fine folks in Talmadge and on Loose Street continue to harp on a company that's just a couple blocks away that could extend their service. And the representative got back and said, oh, you know what, the Loose Street corridor, it could be good. $260,000 price tag, let's send it up to corporate. Maybe it'll be great. We'll solve all your problems. No response, no response, no response. Oh, finally, sorry, guys, it was denied. We forgot to let you know. Okay, well, let's keep trying. So then the federal government, the USDA, they release another grant program to address rural communities' access to the internet. And what's the eligibility criteria? It's very constraining. 90% of the households in the area must lack access. So you take a street like Loose, if you've got 50 homes, right, for example, on that road, and you got a couple connected on one end because there's a line, and you got a couple connected on the other line because there's a fiber line, ineligible. Everyone in between is still out of luck. So we're not rural enough. We are not economically distressed enough. And these grant programs that keep coming out are not favoring counties like ours, and they're not favoring our local units of government trying to address the problem. It's still being driven all by the providers that are lobbying at the table with grant programs. So then there was another opportunity that came out. This got some press in late December, where Michigan secures, $360 million for funding from an FCC program. Well, that's fantastic. Ottawa County, there were three entities. I don't even know what they are. They're probably just DBAs. I've never heard of them before, but they received about $850,000 to hit 1,900 households. Okay, so if the Connect Michigan maps are right, that takes care of everyone, right? Because you're talking, they've got less than 2% of our households. Well, conservatively, what if it's 15% of our households don't have access? 16,000 will still, even with this, we still have 14,000 people, households in the county that won't have access. Just thinking about it hypothetically, knowing that the data is really wrong right now, we know we need to still address it. And the other challenge with this program too, they have 6+ years to do the work if they do. We could have the same issues that we had with AT&T up on Loose Street. We don't know if it's really going to happen. There's no accountability measures written into any of these grant programs, and that is highly contested, and it hasn't changed yet. So Charter, I heard that there was a second 2.0 grant program coming along, and local townships said, hey, I think Charter is going to do something. So I reached out, and they said, oh, yeah, we're taking a look at it, but we have nothing to talk to you about. we're really left at the mercy of these providers. And with the extent of frustration that's coming from residents and others, we feel compelled to take some steps to address what's happening. So some of these intermediate steps, we're fortunate that right in the beginning of COVID, which our library directors all called it a timely blessing, but we connected with them late in 2019 and applied for a grant. So all of our libraries could have at least 10 to start with mobile hotspot devices for residents to check out. And that was just tremendous. And T-Mobile was a great provider. They've actually expanded pretty good wirelessly their service across the county. And those devices, we set up an evaluation protocol to get data from users that were checking those out. And we got some anecdotal data too, just saying, this is so much better than going into a parking lot with my kids to try and have them access the internet. I can't get it home. We had a teacher who reported that I had to teach from home and I don't even have internet at home. So these devices saved her, but they were off the shelves. None. They're never on the shelves. They're always checked out. You talk to every one of our library directors, all 10 of them. There's a huge, huge need in our community for access because everyone wants some of these things. And I had another patron that she was going to lose her, she had some challenges where she had to go court-ordered AA meetings. She's like, I had no way to get there. I lost my money. Devices saved me. So these reports just happen. So we started, again, to analyze the data. And we had the respondents, they have 56% of them that don't have internet at their home. They report that it's very, very expensive, or the service, again, just isn't there. And those folks that talk about it being expensive, that's the making less than $50,000 a year. A significant number of our population are in that space. So the mapping continues to be an issue. Missing data. These maps are terrible. I understand that the FCC right now just has some additional money to improve the mapping. Could take quite a while to do that, of course. But they've continued, even through the Connect Michigan program, to update the maps. So here's some maps from June of 2019. You might recall the older ones that we had from the report that we just don't necessarily agree with. Well, here's another one that says, oh, look at Ottawa County looks like we're basically served or well served. So maps still aren't helping us. So Connect the Nation came back again and they said, well, we got to create more reliable maps. It's the first thing to do. So they gave us updated maps in September 2020. All they really did, in my opinion, was change the definition. Said, so in a census block area, it's a service. And they said, well, it's available to people there, and they kind of changed the colors, if it doesn't cost us an exorbitant amount of money to connect them. So they just changed the definition. They didn't really help us. So that map said, I think we reduced it a little bit, or they did. We're at almost 97% are connected. Still highly question the validity of this data. So we need to take action at the local level. We believe there's legislative advocacy that does need to happen. We should embark on some detailed mapping and start to think about public-private solutions deployment, similar to what we did 10 years ago with the tower building and sitting down with providers and the right providers to figure this out. And we've got to secure funding to do this grassroots style, because right now all the state grants and other grants are going to ISPs and we're left with nothing. It would be great if there were some grant programs that gave money to local governments and county governments to do this type of work. We don't have any information on what's happening with our infrastructure. None of our communities do in the broadband space. We're just left waiting for them and the providers to do something. But the mapping issue is the first step. Washtenaw County took a step to address it. This was their FCC maps, and they said there's absolutely no way that this is true. All the green there for Washtenaw shows that people have access to broadband. They went through a program and got redefined with much more accuracy. The red now is 0 to 10% have access. So they're using this to formulate their next phases of how to address these challenges. So we created our digital inclusion strategy, basically right at the beginning of the stay home order, got together with representatives of the ISD and said, okay, we've got to dig deeper into this issue and figure out how to strategically address these challenges, from remote learning, remote work. Telehealth is incredibly huge, and it's only going to increase beyond the COVID pandemic. So let's prepare our infrastructure in the right way possible for the future. So digital inclusion refers to the activities necessary to ensure that we are connected, even those most disadvantaged have robust internet service that's reliable, affordable, and they have the necessary equipment, and they have the digital literacy training to know how to use this emerging technology. It's the future workforce. It's healthcare into the future. There's a lot of components, educational components, just beyond the infrastructure itself. So our phase 1 component is data collection and analysis. We released an RFP in mid-December. We got 10 proposals back in January. We have a committee, and I'll highlight them here shortly. We've have extensive meetings going through these proposals. We've narrowed them down to the top 4. We conducted interviews of those top 4 a couple of weeks ago, and we're close to, as Al indicated in his State of the County, we're on the cusp of selecting the right vendor to proceed with this work. And we anticipate completing the analysis work by the end of this year. Our primary goal, collect the data necessary to inform our decision-making. That is really important. Access, affordability, and digital literacy. Also explaining digital literacy, which is different, right, than digital inclusion. Literacy is just making sure people have the skills and the connectivity necessary to access the information to utilize advanced digital technologies. We need to make sure people know what they're doing as this starts to grow and it changes our world with technology. Primary objectives to meet those goals: refine the accuracy of our maps, gain an improved understanding of the needs and usage among residents, kind of our current state, and gain a better understanding of the barriers to access by users and non-users. Our steering committee is a esteemed group of incredible individuals. Current membership has the Intermediate School District, Pete Hoswell with the Holland Board of Public Works, Helen Dietrich representing agriculture with Farm Bureau, John Nash, Jim Brooks is heavily involved, Jen Owens of Spectrum Health is involved, and Rick Gajewski of Talmadge. I anticipate including a few more people on this committee as well. We're also being supported by our technical consultants, Urban Wireless Solutions and KLA Laboratories. You might have recalled me mentioning Verizon earlier and how they saw what they were doing. Well, my primary contact at Verizon 10, 15 years ago was Doug Weber. He's legal counsel, he was an RF engineer, he was site acquisition. Well, he retired from Verizon and organized this company called Urban Wireless. And he deals in fiber as well. And he came back to us and said, I want to support what you're doing with all my colleagues. And this commission approved that memorandum of understanding with that group. So it's great to have that technical support with those individuals. Phase 2, solutions deployment plan that will be informed by our data. What's it going to take to address these issues? Time frame, probably takes 6 months to put that plan together. I know Doug and his team are starting to outline the framework for that, researching the space race to have a full understanding of what the right technologies are for us moving forward. Our primary goal, develop that plan that defines the actions that we need to do. Those objectives, prepare the infrastructure plans in those areas where maybe in talking with providers, where do they not plan on going? Said, okay, well, let's step to the plate. What kind of public-private partnerships can we do to make it happen? We also need to know what efforts or programs we need to do to help people overcome affordability and equipment issues, which we know exist. And we also need to, through that plan, identify the additional education efforts to help improve the digital literacy competencies for our emerging workforce, for example, and for elderly that need to have more telehealth services. Talking with Spectrum and Holland and others, that's really big in their world. And also identifying those barriers that we need to address, local regulations, at local government or road commission or state and federal challenges that are really inhibiting what we need to do. Phase 3, that's deployment of the plan. That will just be ongoing. That goal is just to take action, to deploy what we need to do based on that sound informed data that we're collecting. Objectives, likely collaboration to build what it may be, right? As a combination of fiber with wireless daisy chaining, we're not sure, but we need to deploy it. Then can we work with community partners on addressing the affordability issues with residents and other community partners to start working with trainings, working with libraries and enhancing digital literacy and even connecting further with schools, very important. And then those barriers, we need advocacy on multiple levels. Right now, again, we're just challenged. We've got to make some moves. And again, as Al indicated in his speech, COVID-19 quickly amplified how important these gaps are. And there's momentum and there's energy right now for us to start to make some moves. And phase 4 is ongoing transformation. This is important for us too, because we want to continue to monitor what's happening over time to make sure we're appropriately positioned for people to continue to thrive and succeed. So we'll do the data collection this year, but we also want to build in the right kind of protocol, maybe with a local institution where every few years, let's continue to collect data, make sure we've got the right pulse on the public and what their needs are, and continue to be dynamic and malleable to address those needs to move forward. Then lastly, because there are so many other communities that have contacted us, say, wow, what are you doing? We want to keep an eye on what you're doing. We want to learn what's happening in Ottawa County. We've talked about creating maybe a knowledge sharing coalition. We're going to continue to move here in Ottawa, of course, but we can share some of our best practices and maybe collect consistent, meaningful data across boundaries, and maybe it increases the number of voices, right, for the advocacy efforts. We've talked potentially of maybe Talent 2025 being a facilitator of that larger group. But strengthening our momentum, like I said, is really important. We need to continue to establish partnerships and champions and move this forward. Thank you. Questions?
Any questions for Paul?
Nicely done.
Nicely done. Yeah.
I've got a couple of quick questions, and I also agree that was very well done, Paul. It's the most thorough understanding I've had since we started discussing broadband. I appreciate that. And also, I understand that Paul's task force at the NACO conference will be speaking on Thursday, I believe, at 2 p.m. So if you're participating in that,
I think
you can log into that as well. So phase 1 to phase 3, are we looking at 3 years down the road before we get to phase 3, you think, or?
Potentially, I'd like to put us 2.5 years to do that, because it's likely that there'll be some low-hanging fruit that comes out of the data in our solutions deployment plan that we can start to activate even concurrent with the finalization of that plan maybe. So the sooner would be better, but between 2 and 3 for really robust deployment is reasonable.
Okay.
Still aggressive. But
Okay. And a question for Al, I think I brought it up earlier, but that my understanding from what I heard on one of the subcommittees yesterday at NACO, that there would be dollars in the American Rescue Plan that could be used for broadband. Is there a commitment that Ottawa County could make that if they are able to use that, that we would use that or a portion of those dollars for broadband?
Yeah, that's certainly the intent. I've heard the same thing. And obviously, we're still waiting to see what the rules are for that money when it's finally and fully approved and all that. But yes, I mean, I think it'd be a great opportunity, especially, I mean, if we can get up to 57 million, we could maybe put some significant money into broadband. That'd be great.
Okay, thank you.
Anyone else? Yes.
Well, again, I echo what everybody else is saying. This is really easy to understand. Good presentation. What's this going to cost the taxpayers of Ottawa County?
the deployment plan, I don't know. I mean, we need to collect the data, and so that data collection effort might be, I mean, the way we're looking at it would be less than $100,000 just for phase one. We were securing grant dollars from foundations and others, you know, school districts, BPWs, healthcare, all be contributing funds towards our data collection. But the deployment itself, I can't put a figure on it. I don't know.
But we will know before we go forward?
Yes, that plan will be the intent is to have pre-engineering and cost built into that. What's it gonna take for us to build this? And then we figure out how to pay for it.
And then again, does the cost stop there then? I mean, we talk about the underserved people that can't afford this or whatever. So you bring internet service to people who are underserved, which they need, okay? But what if they can't afford now the equipment? What if they can't afford the monthly payment? Has anybody talked about that at all?
Yes. So in addition to making sure that we're designing the appropriate cost-effective infrastructure, that when it gets to the resident bill, it is affordable, trying to make it as affordable as possible. So what's that combination of technologies? Again, we don't know. But in those instances where there are residents that can't afford access, regardless of our best attempts and efforts to make it affordable, I think we should have programming community partners to offer grants, you know, through Community Action Agency and other nonprofits in the county. How can we help to subsidize those that are most disadvantaged?
Thank you.
Greg, I think also to get directly at your question, it would not be a legitimate use of general fund dollars to subsidize an individual's internet. So we couldn't implement and put broadband in people's homes using the county general fund. Right. If the taxpayer money is to be used, it would have to be through a special millage that's voted on by taxpayers, or else other sources of funds that are not general fund tax dollars would need to be found and used. I mean, a couple of things to think about too, I think, is some of the ideas I hear going around the community on this is, in some ways, there's a thought that broadband should be a public utility, much in the same way that water and sewer and electric are public utilities. And so the key might be to figure out how to put together a coalition of some sort to actually build it. And then if the debt cost didn't have to be in the rates because there were grants or nonprofit or whatever dollars are found, then the service itself would be significantly cheaper than if you had to defray the infrastructure costs of building a system as well. And I think as we've talked, there could be like a regional authority or a countywide, or schools, governments, you could have different players that get together in an authority to maybe oversee something like a service like this. So in my opinion, I think what we see will be different. For example, Holland, Grand Haven, and Zealand are well situated to do their own utility for broadband because they own and operate electric systems throughout their communities. The rest of the county isn't as well situated to do that. So who knows what partnerships will end up forming and what that looks like. But I don't see this as anything anybody can take on their own. And I think it'll be something like we haven't seen yet, would be my thinking.
As long as we don't lead the charge, we know it's not going to happen. So I think as long as Paul goes on that strategic plan that he has and the county goes on that plan, I mean, like you had before, we've seen all these grants that were going to cover everything and it never happened. It's been a long, long time. So I think you're on the right process here and just keep pushing hard.
Paul, I know Lake Township in Allegan County went through this too. They had a lot of support for it, and they also had a lot of people didn't want to spend a dime on it. And I don't even know where they finally ended up.
Yeah, I don't think they gained enough votes to make it happen.
Okay,
Yep.
okay, see.
And that's, for us, it's collecting the data and then extensive education on the need and having a robust plan available. We can start to build that support and frame it to something that's really different to make this happen.
Paul, with the data, once we have accurate maps, can we then override the FCC's maps?
And say, hey.
Yes. So you can try, so Washtenaw County has been trying to do that with their mapping, saying, okay, here's better mapping, let's apply for grants. You still have to work with the willing providers, right? And it's really hard to support them. So there has to be some type, I anticipate that public-private partnership to help facilitate the expansion.
Paul, I think you're on the right track. And I echo what Phil said. I appreciate the fact that you are spearheading this and moving ahead. So keep up the good work. Is there anyone on Zoom that would like to just ask a quick question? Okay. Thank you, Paul.
Good. Thank you all.
Next thing is public comment. Is there anyone on Zoom that would like to address the commission at this time?
No, sir.
All right, I'd like to adjourn this meeting then. I'm not gonna-
So move.
All right, we're adjourned.
All right.
I'm not even going to vote on it.
Oh, okay.